Commissioner gets on there. Good afternoon, welcome. Everybody, that was great conversation, though. I'm sorry to break it up because sometimes we don't ever get time just to converse in the hallways, right, and do things like that. So I'm so glad everybody's here. Welcome to the Administration's Libraries and Budget Committee. Would the staff please roll the tape? Good afternoon, everyone. Welcome to the Administration's Libraries and Budget Committee. This is the Human Services and Health line of businesses today. Today is Thursday, October 23rd. Today we'll open with the recorded public comments of the resident services and operation lines of business. However, I was told there are no call-ins, so we will move on. The county administrator submitted her budget to the county board on September 16th. The proposed budget totals $3.09 billion and was based upon a property tax levy increase of 7.79%. The board adopted the maximum property levy increase of 7.79 on September 25th. Today, we will be holding hearings on the proposed 2026 budget with presentations from the human services and the health lines of business. These hearings are intended to allow board members to understand what is included within the proposed budget. Additionally, these hearings will provide a forum to gather public input on the proposed budget. The line of business budget proposals and the complete 2026 proposed budget and the schedule for these hearings are available on the county's internet website at www.hennepin.us/budgets. And at the end of today's budget hearing, we will provide a call-in number and other specifics on how members of the public will be able to submit comments on the budget hearings. I'm now going to go around and do introductions. I will let colleagues know that we have two very meaty subjects, so please be as concise as you can on questions. And we will take a break halfway through as well. So I'm Hennepin County Commissioner Debbie Gotel.
Irene Fernando, District 2.
Angela Conley, District 4. Heather Edelson, District 6.
Kevin Anderson, District 7.
Marion Green, District 3.
Joe Matthews, Chief Financial Officer.
Jody Wetland, County Administrator.
Kareem Murphy, Deputy County Administrator.
Betsy David, Human Services Assistant County Administrator and Director of Finance.
Kate Nelson, District 5.
Clara Severson, District 7.
Laura Hoffman-Boyer, District 3.
Vincent Conte, District 4.
Raina Meyer, District 6. Sharon Sullivan, Deputy Clerk.
Welcome. And as people step up, we'll ask you to introduce yourself if you're called upon for questioning, so I appreciate that. And now I'll hand it back over to you, Administrator Wetland.
Thank you, Chair Gotel. Commissioners, thank you for joining us here today for this budget hearing for the Human Services and Health lines of businesses. During the first half of our time together, we will focus on Human Services line of business. After our presentation and discussion, we will pivot to health. Today, we continue the conversation around budgets and the ways we connect our diverse work to our organizational priorities of disparity elimination and climate action. We know we have a challenging year ahead, but we've been preparing for budget shifts for several years by maximizing revenues, weighing programmatic priorities, and engaging in meticulous and prudent staffing management. A lot of hard work has been done in the budget presentations that you will be hearing about today, and I want to express my appreciation to Deputy County Administrator Murphy and to Betsy David, Assistant County Administrator, and to the Human Services and Public Health teams that have worked to bring this forward today. With that, I'm going to turn it over to Kareem Murphy.
Good afternoon, Madam Chair, Commissioners. Thank you for the opportunity to present the 2026 proposed budget for Human Services. As we have done in previous budget briefings, we will walk through some of the ways we are serving our residents, then we will shift to the details of the 2026 proposed budget. We will share the ways we are managing priorities, challenges, and opportunities, and then close to allow for a robust discussion. Interim Assistant County Administrator Betsy David and I will start today's conversation, and we will be joined today by the Human Services Directors who lead all this vital work. They will participate in your discussion in ways that will allow and facilitate the discussion and presentation. I want to thank them all and for welcoming me into this work. Thank you all. And for their leadership and commitment to eliminating disparities and strengthening the people and communities we serve. I want to thank the leaders and their teams for also the strategic thinking, the flexibility, and hard work that went into crafting this budget during a particularly challenging budget season. There's a lot, more than you saw yesterday. The work of the Human Services line of business is diverse, complex, and vital to the well-being of all of our communities. In 2024, our program served 528,000 people, or roughly 4 in 10 county residents. We're working to eliminate disparities across domains as we provide services and supports to help residents achieve safety, stability, self-sufficiency, and well-being. Here are just a few examples of that work. We've continued to address the crisis in family homelessness by creating a multi-layered system to bring families inside and to help them quickly transition into housing. We're proud of our promise that in Hennepin County, no child sleeps outside. We're also continuing our work to remove barriers to mental health care for young people by partnering with school districts to provide on-site mental health care for students. We know that food security will be an even bigger issue in 2026. You'll hear more about that in our recent work to streamline customer service and support residents. But it's worth noting that even as we've engaged in robust, continuous improvement, we've continued to help thousands of residents put food on their table for their families. This is important, resource-driven work. Ms. David will walk you through the details of our proposed budget.
Thank you. Thank you, Commissioners, for letting us walk through our 2026 proposed budget. The Human Services 2026 proposed operations budget is $846.1 million. This is a 0.5% or $4.6 million reduction from the 2025 adjusted operating budget. The 2025 adopted budget was $840 million. The difference between the adopted and the adjusted are the bars that have come through and as of August 2025. As you can see, there are service areas within the Human Services budget that have decreased their budget. Public Health decreased their operating budget due to a reduction in staffing and federal funding for significant federal grants. Our Safe Communities has a 4.5% increase due to an increase in community contracts. Internal supports, the drivers for this $5 million increase is our IT services, which we purchased through Hennepin County, and opioid, which has a 52% decrease, is due to it being a non-lapsing budget, and prior budget authority expense will be utilized in 2026. Next slide, please. This slide represents our property tax for Human Services. It is 1.8% increase, or $5.8 million, from the 2025 to the 2026 proposed budget. The Office of Budget and Finance instructions for the 2026 budget was a 2% increase. Property tax increases or decreases outside of this annual county request represents the transfer of work between service areas that utilize property tax or from departments outside of the Human Services Department. Next slide. This slide represents our full-time equivalents ask. Our 2026 proposed budget is $3,718, which is an overall decrease of 6%, or 238 FTE. This reduction from our 2025 FTE will be accomplished utilizing attrition and reviewing work allocation. Our most recent payroll is 3,826, with an attrition of 15 FTE on average per pay period. This reduction of 75 FTE before the end of 2025 will help us attain this 3,718 goal budget for 2026. We will continue to utilize attrition and look to not hire for the next year. Next slide, please. This slide represents a recap of the previous financial slides, but adds on our fund balance use request for both the 2025 and 2026 budgets. The 2026 proposed budget is requesting a fund balance use of $60.2 million, which is $10 million less than the 2025 adjusted budget fund balance use of $70 million. We will review the fund balance information in a separate slide. Next slide, please. This slide, which we have presented in a number of our budget presentations in the past. The left side is our operating expenses for the Human Services Department since 2019 through the 2026 budget. The red line shows our average FTE by year. The dark blue column segment is our personnel expenses, and the lighter blue represents our public aid and other expenses. Personnel costs are the primary driver of expense growth in the Human Services Department. FTEs increased by 17% from 3,180 as of December 2019 to 2026 budget request of 3,718, a 538 FTE increase. Personnel costs on a per FTE basis increased over this same period by 31%. These two factors drive the increase in our Human Services Department expenses. Public aid expense, which is represented in that light blue column, includes shelter, food supports, and other community organization supports. In 2019, the public aid was $213 million and has grown to $268 million in the 2026 budget, or a 26% increase equaling $55 million. This increase
I'm not seeing the number.
Yep, it's a calculation that I would have to walk through with you. Yep.
Okay.
It's part of that light blue column, and in future, we can separate it out as a separate color if you'd like, yep. This increase reflects resident demands we serve, including our COVID response initiatives, adopting services from Hennepin Healthcare, such as family home visiting, Teen Hope Pathways, and services transferred from departments like DOCCR, Safe Communities as a service area. One expense initiative for 2026 is working with our community providers to utilize state Medicaid where possible for reimbursement instead of billing Hennepin County. Human Services operating revenue consists, so on the right-hand side is our operating revenue graph. Our operating revenue consists of administrative revenue, a state funding that supports the cost of direct county-provided services at an average of 33% of our costs. This does not include public aid reimbursement, it's only all other expenses. Our federal, state, and local grants that supports programs, fee-for-service, which are charges for services for behavioral health, medical, case management, and social workers. A fee-for-service is a focus of our department leadership and revenue teams to optimize and support the financial stability of our department. Operating revenue has increased $143 million, or 44%, from 2019 to the 2026 budget. Property tax increased $35 million, or 12%. Our grants, administrative revenues, and fee-for-service has grown at a much higher rate than property tax due to the focus on those areas from our department leadership. The other sources of revenue include our opioid distributions, any kind of tax increment that we're receiving for housing. These are the other financial sources and has grown as well. We manage revenues as optimally as possible, reviewing operations alongside a revenue lens that allows our leadership to understand where the strongest revenue options are. This is a continued strategy in 2026. The operational revenue framework for Human Services Department rarely allows us to cover costs at 100%, which means we look for property tax and other supports to assist with managing a strategically healthy fund balance for Hennepin County and our AAA bond rating. This last financial slide represents our fund balance from 2016 through our 2026 proposed budget. The red line represents the actual or projected Human Services Department fund balance from 2016 through the 2026 proposed budget. The columns represent the actual operations in green and the budget in blue. As of the end of 2024, the Human Services Department fund balance is 18.4% of the Hennepin County fund balance. A focus on keeping a healthy operating framework to support resident services, along with balancing support for Hennepin County's ongoing bond rating, is of key importance. As noted on this slide, we operated using fund balance between 2016 and 2018 and reduced our fund balance down to $105 million. In 2019, with significant work from the leadership in human services, we outperformed the budget and added to the fund balance by $4 million, with a transfer in of $14 million. From 2020 through 2022, we added to the fund balance primarily through funding sources that reimbursed our services at a dollar for dollar with COVID response. In 2023, we again outperformed our budget, and we supported our community health care for $24 million, which meant that our adjusted budget for 2023, we had a budget of $78 million of fund balance, but we were able to close out 2023 only using $7 million. The significant resident demand from COVID epidemic and the economic impact on our communities has required our service areas to increase staffing and support our community providers. This demand, along with the loss of COVID response funding, has increased our fund balance use. The long-range forecast for Human Services Department shows continued fund balance use through 2028 under current operations. The Human Services Department leadership is focused on the levers around our expense reduction and optimizing revenue to reverse this trajectory of our fund balance use over the next 3 years and to get to a sustainable financial operating framework. Thank you.
Madam Chair, Commissioners, in Human Services, we're working to support residents and communities. The work we do touches every disparity domain, and every day we work to eliminate disparities by increasing access, removing barriers, and by offering a hand to support residents who need help. Today, we will focus on 3 timely priorities within the broad work that we do: increasing food security, supporting youth and their families, and helping people experiencing homelessness to transition into permanent housing. We know that many residents will face new challenges putting food on the table in the coming months. I should say in the coming weeks. In response to several years of spiking demand for federal food assistance, SNAP, Supplemental Nutrition Assistance Program, leaders and staff and economic supports have been laser focused on the ways they can make the progress of applying for, getting, and renewing SNAP and cash faster and easier for eligible residents. This work has put us in a better position as we prepare to support residents through federal changes that will reduce access for some, with the biggest impacts of the 2025 federal budget year starting next year. You'll hear more about the work in public health that public health is doing during the health presentation later this afternoon. It's been clear for several years that we need to do more to help young people who are struggling with unmet mental health needs and to support their families on their journeys to healing. From childhood mental health assessments to school-based mental health care and family response and stabilization, we're working across the spectrum to detect mental health issues early and to increase access to therapeutic supports to help young people to stay with their families and in their schools and in their communities as they work toward recovery. Stable housing solves homelessness. We're taking a person-centered approach to help people to transition from homelessness into housing, whether they're living in shelters, encampments, or other settings. We are maximizing partnerships, maximizing funding, and meeting people where they're located. We continue to work with our partners in housing and economic development to continue increase to the quantity, quality, and variety of housing options to meet people's diverse needs. We believe our strategies are succeeding. Housing exits last year represented a 60% increase, from 2020. As of October 1st of this year, we have already helped to house just under 2,500 people in this year alone. And yet, one person who is experiencing homelessness is one too many. The work remains. Opportunities and challenges. Like our colleagues in other lines of business, we face distinct challenges in the year to come. Our hope is that the expertise and planning will help us meet those challenges and minimize the impacts for our residents. As part of several changes to federal food assistance, a new cost-sharing requirement will be tied to a state's payment rate error. We're doing our part to reduce error rates by ensuring that our staff are highly trained and accountable, by sharing and expecting timely data, and using data to predict which complex cases most likely will be subject to errors. We're taking a leadership role in the work with partners across the state to reform the waiver system to allow counties to support residents with disabilities in ways that are both sustainable and person-centered. An example is our participation in the Long-Term Services and Supports Advisory Council. We're concerned about the ways that changes to federally funded economic benefits will increase stress on families, increase risk for maltreatment, and increase the untimely and out-of-home placement. We continue to work upstream to reduce trauma for families by leveraging state prevention grants to reduce risk and strengthen protective orders. We're phasing in new legislation aimed at preventing out-of-home placement and preserving families that are disproportionately represented in the child welfare system. Madam Chair, Commissioners, this concludes our prepared remarks. Thank you for your time and consideration today. We look forward to hearing your questions and sharing more with you about the work that we're doing. I'll turn it back to County Administrator Wentland to help start today's discussion.
Madam Chair, Commissioners, again, thank you, Kareem. Thank you to the Human Services team. As you can see, a lot of hard work has been occurring over this past year, and significant headwinds that this team is preparing for moving forward in the current landscape for human services. And with that, Madam Chair, I'll hand it back to you.
Yeah, kind of scary times right now. Commissioner Green, are you prepared to?
Yeah, I can.
Please.
Pull it together.
I'll let you start us off.
Just first of all, thank you so much. There is so much amazing work summarized in these slides. It's this is the tip of the tip of the tip of the iceberg. So I just want to thank everybody who's a part of this incredibly important work that is under duress. I had two questions that I wanted to ask about. The first one was on slide 11. So a narrative that I certainly have in my head is that state support is also dropping, and or like every year just getting less and less. And it sounds like we're doing an amazing job of maximizing reimbursements, for example, and so on. And so that's great. Is that making up for this sort of erosion in state support?
Thank you, Commissioner Green. What I would say is that there's program costs that are increasing from the state and their support is decreasing. What we are looking at is optimizing revenue that is not being impacted. So for instance, our Medicaid, and utilizing forms of Medicaid that will increase our fee for service.
So that does answer my question, which is basically yes, the state money is shrinking, and we're doing what we can to control the parts that aren't shrinking. But yeah.
Yes. Madam Chair, please. Commissioner Green, and as Ms. David identified, I think what this budget is also preparing for is future state reduction in funding. It is not solving for that yet. So the efforts that are being done in the Medicaid revenue growth where possible will be challenging to offset the future state and federal cost shifts that include SNAP that you will hear more about. And it also includes the current work around our reference in the Disability Council at the state level. There is still language and work there in regards to the funding gap, and in that legislation, if they're not able to solve for the funding gap, the current language would reflect that shift back to counties, and those are substantive dollar amounts.
I think that maybe gets at the heart of some of my concerns. This budget looks great and I support it. I still feel like I don't have an understanding, and I know people do, of the cuts that we're seeing on the horizon and how we're anticipating them a little more specifically. And I'm not sure how that could be digested for me, but I would like a better understanding of that. The other question that I had was,
Madam Chair.
Please, go ahead if you want.
Madam Chair, Commissioner Green, I'll just say one thing we struggle with, and I hate to use maybe a problematic term, but it feels appropriate. There are known unknowns. There are ways in which federal legislation impacts how our states operate our safety net programs. It is going to be up to the state government, the legislature, and our state agencies to decide how they comply with those cuts, and that impacts us. So we know changes are coming, we know requirements are coming. The specificity of them and our role in implementing them is what is the unknown.
yeah,
So
yeah.
this budget does its best to approximate what we assume the impacts will be, but until the state acts, the legislative branch and executive branch, we won't know the specifics.
It has to be a bit vague. I think my second question is actually not a question, it's more of the same theme. So I was looking at slide 9, or page 9, slide 17, and just thinking like how much is summarized in these challenges. And I think all commissioners have been hearing from food support agencies in the last couple of days with enormous urgency. And I think of that as one body of the county's work. And I guess I'm not walking away from today feeling like I know our instincts are good. I know people are working hard on this. I don't feel like I'm walking away knowing more than I did yesterday about like, so what exactly are we doing? Where exactly are we sort of shoring up on known unknowns, et cetera, or known unknowns and unknown unknowns. So I want to both ask for that information, but also name it, because the other thing is, as a commissioner, there are few opportunities where I get to talk into a microphone, unless I just do it sort of riffing on the dais, where I just talk about the fear and concern from the community, the fear and concern I have on behalf of the community. And this is one of them. So thank you.
Madam Chair.
Please.
Madam Chair, Commissioner Green, just to provide a little context and maybe just an overall response, I don't think any answer is going to be acceptable. The issue is unacceptable. We have approximately 440,000 Minnesotans receive SNAP benefits. In Hennepin County, there are 110,000 individuals who receive SNAP benefits. There's a cascading impact of the federal shutdown on the way food security is addressed with funding. So there's SNAP, which we have been struggling with the impact of the federal shutdown, operationalizing what was about a 3 or 4 day period of confusion where we were told that applications were going to be shut off at 10 p.m. for 2 separate days. And it wasn't, thankfully. So our staff was able to marshal, and thanks to the leadership in Human Services, and I want to call out Reggie Wagner and Sarah Holly in particular, Directors of Economic Supports and Public Health, for helping marshal that. We had an operational response. So I'll just kind of categorize 2 buckets of response we have. There's an operational response, and then there's a strategy-based response. In operations, we've got SNAP that is getting cut off effectively November 1st. The Women, Infants, and Children Food Supports Program is next up. If increases don't escalate aggressively, the state likely has about a month worth of funding left, so we might get through November. If demand increases, it will run out. So we're looking at roughly about Thanksgiving for WIC. And then the MFIP cash portion will last roughly through the end of the year. And so we have this cascade of safety net funding source, federal safety net funding programs that are ending in succession in the last 2 months of the year. Operationally, we've, Director Hawley may get upset when I say this, but we've stood up a mini version of Incident Command. And we've had almost daily meetings of our staff. So when it came to rallying staff to get to those 10 p.m. deadlines, we were calling staff from various parts of human services and across economic supports to process applications to get into that 10 p.m. deadline. We had to do that for a succession of days. With WIC, we are looking at where staff can be reallocated from other parts of human services to address what we expect are going to be an increased number of demand for those services, for those applications processing. WIC has very specific requirements in the application process, so we can't just do that over the phone. They're required to be in person, and there needs to be discretion and privacy, so we couldn't just have everybody just show up on the PSL and get an application filed. So Public Health is working with facilities to identify appropriate venues and county-owned facilities across the county in anticipation of increased demand. And we're reallocating staff based upon availability of staff to address the application need there. MFIP, goodness gracious, if the federal government reopens, we likely wouldn't have that crisis at the end of the year, but that is right on the end. And so that's the operational response. I also want to highlight that we've had, I believe it's at least 2, I believe it might be 3 separate, I call them emergency calls. These are ones at like 8 o'clock at night. Department of Children, Youth and Families Commissioner Tiki Brown has convened those along with Aaron Bailey, who's the Assistant Commissioner for the Children's Cabinet. They've invited staff from DHS, DCYF, I believe MDH has been on, and Minute. We've been real-time processing some of the challenges we're facing. We're the only state with a specific waiver that allows us to commingle the SNAP cash benefit with MFIP. We needed to detect, there's an IT system, it is Maxis. Those of you who've seen the black screen, the DOS, I think it's either COBOL or Fortran, and some of you might be old enough to remember when that was brand new, but I was. That needed to be, we needed an IT solution. The state needed an IT solution in order to detangle those so that we can maintain the MFIP cash benefit, assuming the federal government doesn't reopen and we're at November 1st, so that there can at least be a benefit provided to beneficiaries for MFIP cash. So those are the operational pieces. On the strategy, we have been meeting almost, I said we've been meeting almost daily. We have, thank you, Interim Assistant County Administrator Davids is here. She's been providing some light on, I said, Incident Command, our financial structure. I mentioned that cascading impact of SNAP, WIC, and MFIP. I'm just repeating myself on the operations side. On strategy, we're trying to leverage those partnerships with the state government, with DCYF, with Human Services, and with the governor's office. There's some discretion we hope that they might be able to exert around addressing unmet need. Thank you, Commissioner Edelson, for sharing with us information.
I'm nodding fiercely
Okay.
to that, yes.
She shared information from California. Governor Newsom has called up the National Guard and allocated $80 million. It's $80 million in California, so I just want to be mindful that's like $5 here for emergency food assistance. So we are prepared to make these requests. What I want to emphasize to you is what we don't want to do is go back with a series of one-off requests to the state. It's taken us some time to understand exactly what the impact on Minnesota that SNAP, WIC, and MFIP are going to have so that we have a comprehensive request. And rather than going back with, hey, we need a fix on SNAP now. Oh, can you do WIC now? And please tell me you're worried about MFIP. So we expect to have an aggressive policy response. I want to call out our partners, I believe, in the room from Intergovernmental Relations. They're going to be guiding us about what specific ask we need to make and what type of ecosystem of support we'll need from the legislative branch on that as well. And then finally on funding, we are addressing what capacity we may have to meet some immediate needs right now. When I mention the known unknowns, we want to be mindful as we advise you on what financial opportunities or financial discretion we may have to address immediate needs, but be mindful of cuts and cost shifts that we truly believe are going to be happening in calendar 2026. So we want to be mindful as we advise you, as you make policy, that you're aware of trying to solve for right now when we know that there's going to be a tidal wave just coming in a few months. So I wanted to give you just a flavor of the operational response, the level of strategy that's weaving into this, and to let you know, we hear you very clearly. We have also been hearing from food security providers and safety net providers and community directly, and we're assessing what is possible, what's appropriate, and where we need the state to pick up. And if you might indulge me just one more moment and just kind of putting on my old hat, I was coached very early on in my time here at Hennepin is when we solve for someone else's problem, we teach them that they can dump the problem on us when the responsibility is primarily on one of our other governmental partners. So we want to be mindful as you all direct us to meet immediate needs, that we're just mindful of how we may be training our partners.
Thank you so much. That was really informative, and I think it really spoke to the information I was looking for in terms of just a deeper understanding and how we're responding and what isn't known. And I appreciate that in the same way that you outlined how we don't want to go to the state specifically with one-off requests, you're also sort of doing that environmental understanding for us as well, so that it's also not a bunch of one-offs. And maybe I'll leave it at that for now, but I'm just really grateful for this additional conversation.
We have a lot of commissioners to get through.
Yeah.
Commissioner Fernando.
Oh, thank you, Madam Chair. I really appreciated the slides 11 and 12 for the kind of multi-year picture. I'm very, very proud of the work that Human Services and Public Health does. The outcomes, the diligence, the methods, the partnership, particularly over the last handful of years, we have really driven and set a vision for community response that is multifaceted, moral, compliant. I'm so proud. And I appreciate how diplomatic you can speak today. I'm quite sad and angry at the context we find ourselves in. So these two slides were very helpful, 11 and 12, so I just have a few things I'll bring up. I remember when you all kept performing better than budget. I know that there were some infusions and whatnot, but the diligence there, thank you, and we need to clearly keep that up. To clarify, where the 90 million is shown in the orange bar, then in the admin bar, where does fund balance show for slide 11?
So for slide 11, it is the red, I'm sorry, it's not on slide 11. It's on 12, I'm sorry.
Right, but where does it show, right? Because use of fund balance is considered a revenue, or is it not? That's what I'm trying to get at.
Yeah, so fund balance is that red line. So you can see that our proposed budget for 2026 leaves us at 90 million. Yes. And
The use of 60 million shows up where on the bar chart?
right underneath that.
Go ahead.
Commissioner Fernando, Betsy.
Oh, I'm sorry. Is it the 60 million, is that included in the light blue and this one as property when?
Yeah, is it
it's-
property tax or is it?
When you're, this one that shows what the revenues is to the budget?
Yeah.
Where does the 60 million sit in that color? I mean, the 60 million fund balances use is in your expenses. So it's in your overall expenses. Your fund balance is not shown in the revenue. This is just pure what the revenue is going to be. It's not, that your fund balance use is not showing up there.
Interesting. I'll have to take out my T accounts next to these
Yep.
8 tracks
Yep.
and maxes. Okay, I'm back. I'm back. You like that T account joke? Wow, that's really getting me somewhere. Okay. Yeah, okay. Focusing.
78?
So you could theoretically, the 319, or 19 million of property tax
Yeah.
that's in that light blue, if you add in the fund balance use, that would be total use of property tax, so to
Yeah,
speak?
that's what I'm trying to get the source, and you'll hear where I'm getting at. Because on the budget book on page 17, I was kind of with, I'm sure all of us looked at the amount changes from federal, state, and local, right? So I'm interested in this elongated view around the revenues with federal and state. And then, like I said yesterday, with our local jurisdiction CIPs, or the other day, I'm nervous for all of human services. I mean, we all know that human services across the state, if we are feeling like this, if I am feeling like this, then I can't quite imagine what is occurring in the other 86 counties, and specifically our rural partners. And I say this because of, from a legislative advocacy perspective, we shouldn't solve other people's authorities too quickly. I've been provided that feedback as well. And I just can't quite stand good outcomes that we've achieved, that you all have achieved, being for any reason not funded in future years, or for any reason not being expanded to other counties as those county boards and those county administrators deem fit. So I'm interested in the overall arc, and then the math now, because maybe there is a way in 2026 for all counties to come together and at least attempt to establish a revenue source to fund these important, essential, mandated, not funded services. And this isn't, for me, this isn't like a blame situation. It's just we have to find the math. What is the true math? And if for some reason, like, I don't believe that the state reimburses us for that tower, for example, all the time, maybe there are other ways by which we can account with the state, because there is money being exchanged between our organizations, and we are all better off when we center the most marginalized and seek to ensure that the services that are proven to work remain funded and operating. So mine is about the high level math and really making sure we are compelling and succinct with what we are requesting for by way of partnership. Second thing that I'll say is two more things. One, just on page 19, 430B. It says 403B on top, no worries. But is it 430B or is it 403B?
It's 340.
340B. Oh my gosh. Well, there's a bunch of numbers. Okay. Is it 340? So it's 340B for the pharmacy? Okay, so on page 19, there's just a couple typos on them then. But I'm interested in a deeper dive on this portion too. Who utilizes this particular statutory authority, in what ways? If this is also an area in our hospital system and North Point, and this is a swing. This is one of those numbers, colleagues, that it'll hit us 2 or 3 times. Because pharmaceuticals are generally an area of high revenue for any clinical setting. And so if there's rate, like this is one of those measures that is not just the number. There's a potential multiplying effect. So I don't need answers on that now, but I wanted to flag that. And then with respect to food and healthy food, this is slide 14. Of course, we're all hearing from everybody with respect to the current context, and it's the decimation of public good is just completely disgusting and aberrant what's happening right now. So with respect to food, and I'm usually try to be, upbeat or encouraging, and it really is not a reflection of everyone's performance here. I'm very, very proud of the work that you do and the work that we do. It is just so heartbreaking. So with food, we have been creative with and have sought to embed dignity with North Point, with funding providers, even when the state and others told us to not fund food providers. And so I will just try to get even more creative. I authored that North Minneapolis food desert because we had no grocery. I said this before, I know that folks on the dais don't all think this is a good idea necessarily. I don't think we need to own a municipal grocery store. Okay, I know that's not what I'm saying. I'm not saying that, but we do need to increase creativity here. If SNAP, economic assistance for the purpose of food, right, if that is taken away, one aspect is funding and one aspect is what grocery stores are we partnering with? What discount rate, what card, what are we instituting? Now, I'm of course a bit biased because we know that all the grocery stores departed North Minneapolis and District 1 pretty close to one another. But North Market, for example, like what would it look like if we made our food shelf a little bit more grocery-like? How can we make grocery stores slightly more affordable in this particular moment where government assistance has disappeared and free market with respect to grocery stores in areas of high concentrations of poverty do not enter? And I think that's all I can muster. Thanks, Madam Chair.
Any comments?
Madam Chair, Commissioner Fernando, thank you very much for those comments. I will tell you, our incident command-like structure met just this morning. They met yesterday. These are the exact type of ideas that we are assessing right now, their viability, how quickly they might be turned on. And if, with your permission, I would like to invite Director Holly up, if you care to just give a quick report out about where we are on some of the specifics here.
Good morning, everyone, Madam Chair, Commissioners. Yes, Sarah Holly, Public Health Director here for the last 16 months.
Whoa, already?
Yes, it's been that long. Thank you for the opportunity. So this past July, Public Health and Human Services stood up a federal impact response planning team due to Congress passing sweeping Medicaid and SNAP funding changes to mitigate the impacts on Hennepin County and its residents, and to respond through central coordination and to streamline efforts and share information. We have representatives from Public Health, Human Services, Economic Supports, North Point, HHS, Hennepin Health, IGR, Finance, Data and Evaluation, and Communications. And I would also say the County Attorney's Office when we need them. Yes, kind of does, but. Deputy County Administrator Murphy is the sponsor of this effort, with Bobby Jackson, Reggie Wagner, and myself co-leading this effort, and project managers who are supporting this, Lang Yang from Public Health and Maddie Johnson from Internal Services. Because we are mobilized to respond long-term, we have been able to pivot to recent federal shutdown initiatives that are happening here at the state and federal level, and very recently, the impacts of SNAP, MFib, and WIC. So we're utilizing this response and mitigation structure to best meet the needs of our residents during a very challenging time, not necessarily calling it ICS. Thank you.
Thank you, Madam Chair. Commissioner Fernando, thank you. And I know Director Holly sat down. The other thing, not only is there this right now an immediate response, and I think that's part of the challenge, is we have an immediate crisis that our team is working on. There is also some actually phenomenal long-term work under the health disparity domain around exactly what you're talking about. How do food shelves look more grocery-like? How do we create grocery and access to food across the county? And so I think we can follow up more with the work that's been happening that sits across lines of business. So it includes partners in housing and economic development. It includes our public health and human services. And with the changing in our landscape, this work and the urgency that you're indicating, I think, is even greater.
Thank you.
Yeah, thank you. Commissioner Conley?
Certainly. Thank you, Madam Chair, and thanks to everyone who had a hand in putting together this budget. This is, I always look forward to this one, but all of them. This one I'm most worried about, as you've heard, we're all very much worried about this. I am a big fan of, I'll call it the mitigation squad.
That's a nice.
We need to keep that even with the known unknowns and the unknowns, since that's the word of the day, right? We need to keep this group of folks together, meeting regularly until we know what those unknowns are right now in 2026. One of the things that really stood out to me, as solid as I think this budget is, given with what we don't know, is the FTEs and the staff. I was gonna ask about what a healthy fund balance looks like. I know when we came in 2019, there was a lot of concern about fund balance use then. We mitigated that. It continued to rise, and now we're at a level that's not sustainable, and it's for the next, I think I heard 2028. So I will ask about what healthy might look like. In the interim, though, I stopped on page 15 of the budget booklet, which is Human Services has implemented an FTE strategy that allows for utilizing attrition, using data to review service area staffing needs against service demand at the department level, with a reduction of FTEs. But that, to me, help me not make that, because to me that sounds like a contradiction because of additional SNAP requirements, additional Medicaid, additional reporting requirements, work requirements, things that the federal government decided vulnerable people need to do, poor people need to do, right? Things that we know aren't necessary. So because of this attack on our residents from the federal government, I don't know that holding FTEs and not filling them is something that, I need that to settle better with me, so please help me understand better.
Madam Chair, Commissioner Conley, thank you. I'm going to start, and I'm going to look to our CFO, Joe Matthews. So I think, and just a credit to the work. So one of the things, and I'll look to Betsy as well if I am, so feel free to assist. So one of the things that Human Services and Public Health have done really well is actually we call it position management. It's actually being modeled countywide in it. And so in looking, as Betsy indicated, one of the strategies to slow down our budget growth or manage, because that's the crisis, is if we would have not have done that, this budget would have been in a really challenging situation with a lot of unknowns of what's coming. So how do we prepare? However, within that, by doing it through attrition, really trying to protect where volume needs were. So a lot of tools and thoughtful allocation. And so when there have been needs, even within this budget, allocations of staff are provided. So for an example, SNAP and some of those pressure points. It is not, when I say that, I mean, this is still a significant reduction in FTEs. So it is not a perfect answer, but amazing work in watching where resident needs are and adjusting. This work, and I'll let Joe talk about it, is expanding countywide. And so as a county, we need to be more nimble around capability about where we're allocating workforce, where we see the pressure points coming. So would you take that?
Yeah, thank you for that. Madam Chair and Commissioner Conley, I think a theme of this budget overall, and I think you've all experienced it through the prior budget hearings, has really been a balance of our mission, vision, and values, and the resources that we have available, and how do we line those up without compromising the core of our services. So overall, the 2026 budget has a reduction of about 250 positions. If you were to put a dollar figure on that, that's about $25 million that would have been additional property tax levy to fund that. Betsy's team and the whole team in Human Services have been leaders, as Administrator Wetland called out. They have done a phenomenal job, not just this year, not just last year, but this has been a multi-year effort to really become nimble and frankly, very diligent at just making sure every time we hire a position, we're trying to bring it in where it's most needed. We are bringing that same spirit countywide. There's a similar, I think, conversation that's playing out within every department on a different scale. Keep in mind, Human Services is 40% of our workforce, so it's a huge number. They have more flexibility just through that attrition to try to move positions around, but there are limitations to that. And so I think the other piece that this ties into around the fund balance, sometimes you'll hear local governments refer to those as their rainy day fund. It is certainly raining. And, you know, I also want to highlight something on that chart that shows the revenues. You'll notice when we go through the years with the green lines, the pandemic funds, this board and your predecessors really did a good job of helping us position to ride through that pandemic. And you'll notice that we don't fall off the cliff. I just want to celebrate that one last time. This is about transitioning into sustainability. The headwinds when we adopted the 2025 budget we did not expect this level of disruption regardless of election outcomes. This was not anticipated. And so it is a regular conversation with myself, with Betsy, and with her team, as well as Administrator Wentland and the deputies. We are trying to make sure that we're being very thoughtful on how we spend our fund balance. And we can't go back over and over to that well. And so I hope that wasn't a roundabout answer to your question, but we really have tried to prioritize how much property tax do we think we can responsibly recommend, how much fund balance can we use, what can we support? And then on the FTE side, we, I think, started this budget process, and I'll look for a head nod from both Betsy and Jody. We did not want a budget that we thought would compromise our ability to deliver core services. So this is not easy. I think for the public and for taxpayers to understand, even with this levy, there are a lot of reductions that departments are making or efficiencies they're trying to gain. And we're doing that in a way that we believe will sustain services. But of course, it does add risk as there's state or federal reductions.
Madam Chair, Commissioner Conley. Thank you, Joe. I think one of the additional things I'd like to add around this budget in here is this budget is kind of two parts. This budget is staffing, which is a significant proportion, and then the other portion is our contracts. It's through our public aid. When Human Services looked, knowing the headwinds that are coming, and those were better looking headwinds than we have today on it, Human Services looked at both sides, and what we saw with the public aid was two parts. Majority of the public aid funds are funding for our community partners to do the work that if they didn't do it, we would do it. We're mandated by statute to do it. So that is a good majority of the funding. So when you remove that, the funding that was at risk would be funding that provides food that we did not cut and critically needs, especially in times of what's happening right now. It is providing it's actually housing and homelessness. None of that is mandatory services, and yet we know that is the right thing to do. So this budget reflects protection of what Joe has indicated. It is the core safety net for our community as best as they can in it, and kept all of those programming and funding stable. So the two levers that this team is working so hard to do is increase revenue where they can, as hard as possible, manage staffing growth as best as they can, and allocate staffing, and they have phenomenal tools to do that where the pressure points are. This is not I always call it fun budget, but this is not. This is a challenging budget. It has been heartbreaking work that this group has done with the core. It is about the residents every moment. So they're giving you the best they can, and yes, it is a reduction in a significant workforce for us to deliver what we think we can today in the current context.
So, Madam Chair, let me be very clear that I understand and appreciate that, and thank all the staff that worked on this, and the staff who do the work on the ground every single day, right? And who are being flexible to move around to where we may need them to go. Like, that's the big, right? So that is not lost on me. In fact, in the back of this booklet, looking through all of the contracts that we kept whole, I put exclamation points and highlighted those. So thank you for that. This is not lost on me, that because our federal government chose to attack our people, we have been made to make really tough decisions. So that piece isn't lost on me at all. And I know, Madam Chair, we've got other commissioners to get to, but let me finish up with page 18. I just want clarity around the other financing sources. Talks about the housing emergency, rental assistance, 24/7 shelter, and family overflow shelter ending in 2027. I'm gonna assume that's ending from this budget, but not ending entirely. So just clarifying that for me would be.
Please.
I can take that.
Okay.
Thanks, Madam Chair. So under the other financing, what you're seeing is an itemization of funding that we used out of our local affordable housing aid in 2026.
Okay.
The family shelter overflow, the reason why that is saying ends 2027 is that the anticipated need from this particular revenue source is not going to be ongoing. So the program is not ending. I want to be very clear. But we saw a higher need in 2026 than what we're projecting for 2027. And so we're just trying to be transparent with you and the public that the LAHA funding for that particular need, we plan to allocate in 26. We don't currently have plans to extend that into 27 because we're not seeing that need. That could obviously be revisited next year when we do the 27 budget, but that's our current intention.
Thank you. Thank you.
Okay. Commissioner Anderson.
Thank you, Madam Chair. I'm going to express similar frustration around seeing reductions in the human services, through attrition and the whole bit. I understand the need and also express the gratitude of the hard work that it took to get us here. We had a budget hearing yesterday where we heard about libraries and the other pieces of what we do that were largely held. And to see cuts in this hurts. And so I just want to acknowledge the pain that brings, right? On slide 9, that's the staff reduction piece of it. I'm curious if it would be possible to get information of in which areas we're targeting those holds and to what extent those positions are providing mandated services or if they are providing like our value add service. Because I mean, everything that we do is valuable. But I would like to get a better handle of how much we are targeting these reductions in things that are optional from a statutory standpoint versus what are mandated services for us. And I think that kind of goes across our budget books. I would love to see where it is that we're holding positions, how, are these positions deemed mandated through statute or not? We know about the November deadline on SNAP. You mentioned WIC and MFIP kind of cascading. Do you have an idea of the numbers of impact, the numbers of people impacted in those? How many more people are going to be impacted in Thanksgiving? And then how many more people are going to be impacted at the end of the year? Do you have that information now? And if not, happy to receive that later.
Madam Chair.
Please.
Commissioner, I invite Reggie Wagner up, our Director of Economic Supports, to respond to
Welcome.
that.
Welcome, Rachel. Yes, please.
And if I could add on while you're looking at that, the dollar amounts that are attached with that.
Sure. Thank you, Madam Chair, Commissioner. Reggie Wagner, Director for Economic Supports. So the immediate, what we call our SNAP standalone food assistance is about 92,000 current active individuals. It's also an area where we've had a lot of growth week over week in applications in the last 3 years that has not subsided at all. So that's active open cases, and that's who we are most concerned being impacted by the interruption, possibly, of the SNAP benefits. Just want to clarify that the SNAP benefits are paid out kind of in a staggered over November 4th to the 13th. Every state has a slightly different payment distribution. So while we're concerned about November, it would hit on a staggered family basis from 9 to 14. That's how the SNAP payments are kind of provided through that EBT transfer. So just to clarify a little bit what November 1 means versus November 4 to 13, as we hope that there's a resolution. Then the other area is our, and that's 100% federally funded, changes down the road maybe with the recent changes from that HR 1 federal legislation. But right now, all of those SNAP benefits to families are federally funded. With the Minnesota Family Investment Program, that's our main TANF Temporary Needy Assistance Fund. That's a block grant that comes to the states. So the way in which we get the funding can also mean that recipients are impacted in different ways. So SNAP is sort of every month. It's through that EBT transfer. It's very immediate. That's one reason why we're talking mostly about SNAP right now. With the Minnesota Family Investment Program for here in Hennepin County, we have about 6,900 current families that are on that. And that's about, I believe, 19,000 individuals, right, when we count all the household members. They receive, as our Deputy Administrator, Mr. Murphy said, the kind of combined MFIP cash and food portion. So if there is an interruption of the November SNAP, then those 11,000 MFIP families will not get the food support amount. The cash, and we're so grateful that our state was able to come up with a systems fix to it, the cash right now will not be impacted, and that generally gets paid to a family on the last day of the month or the first day. So right now, we expect all of the families to get their MFIP cash. The impact as the year goes on with the TANF program can be a little bit even less certain because we have a braided state funding stream with that TANF block grant. Okay, the state has what's called a maintenance of effort. State also has a TANF reserve, a fund balance. I don't know the exact number of it, but they generally have that. And so there may be levers in which our state, if this shutdown were to persist, may be able to look at what funding they were pre-authorized as part of that block grant, and then also what flexibilities they may have because of fund balance or state use. So there's just a few more levers perhaps if this really were to persist to late in the year. And again, SNAP does not have that sort of braided funding stream and those potential levers. And then for WIC, I don't know if that's, Director Holly would have more of those numbers.
Thanks, Director Wagner. Madam Chair, Commissioners, sorry for that echo. So currently our caseload for Hennepin County WIC is around 13,000 individuals. As many as 10,600 children 0 to 5 are SNAP enrollees eligible for WIC but are not currently enrolled. So if that gives you kind of a number of the individual families that could be eligible, that are SNAP recipients that could be eligible for WIC. This is a very high estimate as we do not have data on WIC participants who received WIC through Bloomington, Edina, and Richfield because they have their own local public health departments. Even with this high estimate, capacity for Hennepin County WIC would reach very rapidly. So we'd reach kind of our capacity very quickly based on those numbers. MDH WIC has stated that they anticipate WIC benefits through mid-November as of October 20th, 2025. I want to mention that while there has not been mention of a cap in funding for WIC benefits, if we see an increase in WIC participants, the redemption period could increase the level or could decrease the level of funding that's available to participants here in Hennepin County and throughout the state. I also want to briefly mention that, our annual WIC grant, which is funded through the USDA via MDH, we receive annually about $4.4 million from MDH and an average of $372,000 a month for operating costs. So that includes WIC staff salaries, supplies, equipment, communication, interpretation for our residents, travel, and other expenses. Just to give you kind of a taste for what the redemption looked like in September of this year, we had about 15,738 participants who redeemed around 1.1 million in food benefits total for that month. On average, we're looking at about $87 for the month, but around $91.50 average for that month if we exclude those that did not redeem any benefits, even though they were issued.
So, sorry, it looks like.
I'm sorry, Madam Chair, Commissioner Anderson, just a little bit on the average payment size for some of our SNAP and MFIP. So on average, it's about $18 million per month that would go to our Hennepin residents. That's based on all we paid out in 2024. The average household payment is about $287 across our SNAP. And so that's families as well as up to our seniors. So it can vary for lots of reasons. That's the average payment. For the MFIP cash grant that families rely on, again, it can vary based upon household size, but the average SNAP grant is $585 a month. So, so that puts just a little bit of what the impact is. Nationally, the way they talk about the WIC versus a SNAP, on the national numbers for the federal budget, it's about 300 million for the WIC program, and it's 8 billion for the SNAP program as an annual budget. So, so again, WIC is vital, and knowing that there are so many children on SNAP that are just not on MFIP, and that gap in funding, I mean, these are both critical. They serve different needs in different populations, but I think that's why we know we're most concerned about SNAP and the impact across our communities.
Thank you. So, I mean, kind of assuming, I don't want to say assuming, but absent levers being pulled per family that is receiving benefits, they're looking at losing $580 a month at kind of a high end if they were receiving the full MFIP or kind of the average MFIP kind of full braided funding for that, MFIP SNAP braided together. And then there's $87 a month that would be per WIC family, or family receiving assistance through the WIC grant. I mean, these are, for families who need it, they are life-changing. And I would dare say they are still insufficient in today's market. You know, we have increasing food costs, we have increasing housing costs, everything is more difficult, and everything about this is punishing those people who are at the bottom end of the spectrum, who are least able to afford it. And I'm going to try to not be bad. Yeah, thanks. But it strikes me like I would really love to see, I mean, before these changes have gone into effect, I know I have gone out to the food shelf in Rogers, Minnesota, that is on the border of, you know, Wright and Sherburne counties, and serve kind of shared rural populations. And the line of people waiting to get in at that location stretches around the corner. There are no parking spots open for people in need lining up. At the end of this month, that line is going to get longer. At the end of next month, it is going to get longer. At the end of the year, it is going to get longer. And I know it is not the county's individual responsibility to solve this problem. And by the numbers, I mean, we would have to shutter every library to try to do this. Like, I don't think that's an acceptable solution for us. But sorry. All right, I've expressed myself. Thanks.
I think we're all frustrated.
Great job. And then just to resident services, my apologies, yesterday I was a little on fire about this, so I couldn't even ask a question. So thank you for all you did yesterday as well. On this, a few things. Human services is why I ran for office. It's what, you know, my mom is a person that lives with a disability. All of the things that kind of intertwined between my life, you know, becoming a guardian ad litem, child protection, all of those things, trying to keep family. Food shelves are actually much better than they were when I was growing up, let me tell you. So, and we have made them more like grocery stores, thank goodness, because they were terrible before. But I want to talk about SNAP. And then actually, Raina, can you pass away? I have every Hennepin County food shelf has already written a letter, and we're going to be passing it out. I just want to make sure that everybody has a copy of it. They were supposed to be sending it this morning. So I just would say it's unfortunate that this is happening right now, because I think it's taking from the important work that Human Services is doing, which is never valued like it should be. Whether it's waivers and waivers reimagined, and the idea of that is really good, but people might not get as much funding. But SNAP benefits right now, I just emailed Patrick Tanis, which is the governor's chief of staff, with you, Jody and Cream, because right now it's, in my mind, if, we're in the business of the people. The whole reason a county operates, in my mind, is to help people that have the least. And how do we make sure that we're fighting for them? And right now, I feel like we have to armor up. And to Liz, I see you in the back. Like, we need to push the state, because if we're not going to stop, if they're not going to give money, then I'm sorry, I propose that we stop playground grants or something. So unfortunately, if kids are hungry, they're not wanting to play on a playground. So I just think that we honestly, it's very unfortunate we have the federal government we do. And I think the crisis moment that we're in is by design. I mean, the reality is what I think this overarching theme is let's push people back to relying on religious institutions to get their food. We have made it more, we've put more integrity in that. I mean, the reality is, as a county, we have to figure out what do we stand for in these moments, and we have to fight. And I would say, honestly, every one of us should be emailing our lawmakers right after this meeting and saying, Commissioner Brown, Governor, what are you going to do? $80 million might not be anything, but Colorado's also injecting some money. We need to hear something from the governor, and we need to hear it this week. And hopefully it will be resolved, but I talked to my friend Congresswoman Morrison, and she has no indication on when it will end. And I get why they're fighting for it, because people will lose their health care. So the idea of where we're in this moment is really challenging. And I think it throws all of us off, because we're trying to fight fires everywhere. And I would just say, I would also, Reggie Wagner, it's really good to meet you. I want to see us invest in how we can help emergency your area, and making sure that we have some technology, because if we don't have people, and if we're going to take people away, then how can we I honestly want to see a work group that can help with the services that people are coming here for. And I would love to see an investment. I want to see that in capital investments. Commissioner, you asked if I have any amendments. That's one of the amendments that I would like to see. That we figure out how we can do better at economic supports, and figuring out if there's AI or whatever it is to inject to help, because it is growing. And then I want to know on work requirements. Right now, those are actually starting to take place, is my understanding. If you could just give us an update, because while we're responding to the emergency need of what the government shutdown is, we're not even talking about the work requirements. By the way, work requirements are going to kick more people to a food shelf as well. So, and then we actually are cutting. I mean, it's not much, it's just 26,000, but I saw in the back here in our food insecurity, there was 26,000 negative reduction. It's at the back. I just want to make sure, and kind of curious as to what that is and why. But if you want to talk about the SNAP requirements, and then if we could talk about the 26,000, and then I'll be done.
Please, Reggie.
Madam Chair,
Yeah.
Commissioner, what page were you referring
Okay,
to?
I'm going to find it right now. I saw it at the back. Here, it's page 25. It said 2025 adjusted budget, 2026 proposed budget, 4 million. Before it was 4,026,000. So if Reggie, if you just want to give me an idea of how work requirements are going, and what we project, if we have any projections in terms of how many people will be impacted by that, that would be great.
Yes, thank you, Madam Chair, Commissioner. So yes, so what you're referring to now is part of that reconciliation bill that passed over the summer that made a range of changes to the SNAP program in particular. So a couple of things. One, just to be clear, SNAP always had a work requirement to it and had exemptions from the work requirement for different populations. And so what they've done now through the changes in this federal HR 1, the bill, is expanded to certain new populations that they now have to meet the work requirements. So the populations that are sort of the key ones in the final bill were families with a child with over 14, so 14 to 17. So different versions of the bill had even younger kids. So I guess the good news is it's older children. So that narrows the number. We think that in our caseload may be about 1,100 families that might be impacted. So not necessarily each month as we review their SNAP eligibility, but throughout the year, that's our best estimate right now of what we have. The other big group that is impacted is they've changed the work requirement age from capping at 54, so it's now from 55 to 64.
Was it 65, isn't it?
Well, I think once you turn 65, then you're no longer. So it's under 65. And yep. So that is a group. We're still reading a little bit of the federal guidelines. But the point is that the federal government, Food and Nutrition Service, has made clear, USDA that oversees this program, that these requirements are in effect as of November 1st. Okay, so I think a lot of states thought there would be a more consistent implementation guidance and timelines and technical assistance, as has happened in the past when large policy changes were made. And quite honestly, I think they just weren't. And the feds are very clear that it's November 1st. So we have, SNAP is one of our largest applications that comes in on a weekly basis, probably I think about 5,000 a month minimum that we seem to get for applications. So on November 1, we will begin reviewing for anybody that fits that family and that older eligibility as part of the initial SNAP eligibility requirement. If they're not meeting the work requirements, and that can be up to 80 hours of work in a month, it could be a certain dollar amount. So perhaps depending on the job, you might not have to do the 80 hours if you're at, $20 an hour, let's say, versus minimum wage, right? And so, and it could be through some type of education. It's a little bit harder for the typical college student to qualify, but there's some ability. And it could be through volunteering or a combination. So if somebody's meeting it already, great, they'll be on SNAP. And as long as they're meeting it at the time of renewal, their months won't count. If they're not meeting it, then they will be limited to 3 months of SNAP in a 36-month period. That's what we call our time-limited recipient. Nationally, it's called that funky ABOD, adult bodies without, adult without children. Sorry, we don't use that anymore, and that's why, all right? It's time-limited. So, I know, I can't even say it now, it's terrible. So the bottom line is we have to roll those out. We'll be doing it as families come up for renewal. We've been partnering really closely with our workforce development team that oversees our SNAP employment and training providers to be prepared for this, to make referrals to our community-based providers so that if somebody is not meeting them and wants to participate in career advancement training, there are going to be many opportunities. So we have a lot that we've been doing to get ready for that, but it will impact. We think the group that is in that older population is about 5,000 households.
Please, go ahead.
Madam Chair, Commissioner, I'll invite Blaine up to respond to your IT question. And while he's making his way up, I just wanted to comment the difference of the 26,000. That was a one-time allocation that was designed to ensure that some targeted food shelves could function and look more like a regular grocery store. So that was a one-time operational cost. So that wasn't, there's no reduction in any of the FTEs. That was a competitive process. So the 4 million remains at 4 million.
Thank you.
In the proposed budget.
Good to know, that's good.
Madam Chair, Commissioner Edelson, my name is Blaine Robertson. I'm the Business Information Officer for Health and Human Services. You were talking about what are we doing in IT? Well, when I got back to our department, because I was here for a long time, then I went to Central IT, and when I got back, I was in same conversations I was in before I left. Oops, sorry about that. So I asked if I could start doing proof of concepts. So that's what we're doing. We're working with the state of Minnesota, but we're working on applications that nobody else is doing. And one of the big ones, because Commissioner Conley mentioned Maxis, we're actually putting a web front end on top of Maxis and creating screens which includes multiple Maxis screens together. So we just implemented it. I should say we put it into test production to see if we can get it working. So that's where we are right now. But we also did proof of concept with the direct care and treatment. We also did proof of concepts with the data and data warehouse. Our Hennepin County views that we've had for multiple years are now being rolled out to the rest of the state of Minnesota, and now they're calling them I-County views instead of I-Hennepin views. So these are things that we are working on because we just weren't getting anywhere. So that's why we started doing that.
Madam Chair, just one quick follow-up. So I think that's great. I mean, Maxis is, yeah, I was at the state. The reality is, and with what the state is facing right now, we're not going to wish our way out of it, right? They are facing economic uncertainty as well. So what you're talking about is what's internal, and I think that's helpful. But what about what people are seeing? And then also people right now are still, Reggie, you know this, people are still waiting on lines. They're getting calls that are dropped. We're getting calls from people that were providers saying that they're still struggling to get through. There has to be more innovation in this space. I want to see us invest something that will actually really be transformative. And what are you thinking about in terms of that?
So, Madam Chair, Commissioner Edelson, there are multiple projects going on right now trying to alleviate some of those waits. But we have looked at different technology, especially in the phones and the online application stuff. What happens when people fill out a min benefits application, it takes them like 10 minutes to fill it out, which is great for the resident. It's great. But that is replacing an application process when somebody came into the office that took them 2 hours to fill out. So they knew right away if they were going to be able to be approved or denied. Those are things that, it's great for the resident, I understand. I would love to fill out a 10-minute application, but if they were disqualified, it was a waste of 10 minutes.
Well, but that's it, Madam Chair, that's it. So they're applying for things. They don't know what they actually qualify for first. So then our rejection rate looks high, and so it's not working for residents. It's also not working and it's not your fault. I want to be very clear, and it's not any of the staff's fault. It's not working when somebody's sitting on the call for 2 hours either. So it's not working for residents. We've got to figure out ways to be innovative here, and that's where policy work, this is where our policy work comes in. The system is working the way it was designed to work. It has flaws and complications. But technology and innovation can potentially help us, right? I was just in California, I was taking a Waymo car, which is like a self-driving car, and I'm like, oh my gosh, it was amazing. Honestly, it was amazing, and it could be really helpful for seniors getting places. It even had an ability to take a person with a disability. How great is that? Because Metro Mobility here is like 2-hour waits, right? And then sometimes that person has to stay in the car. Technology can help us. And I was disappointed to hear that in our capital investment budget that we didn't have an ask. And so I would like to see us think really creatively, because really strong innovation can actually be in that budget. And I'd like to see it in the future. So
Administrator Rutland would like to speak to this. Go ahead.
Madam Chair, Commissioner Ellison, thank you. I think, so a couple pieces in regards to the budget, when it comes to the technology and the work that Blaine and his team have done and the investments, it's reflected in the Human Services and Public Health operating budget, ITRM. So it's one of the unique things that we've done. And Betsy talks about how we maximize the reimbursement. It allows us to pull down the federal reimbursement. And so those funds are invested, and we have continued to invest funding in our ITRM area to help continue building that out. The other component is that many of these systems that Blaine is touching on are state systems. Min Benefits is a state application. Our team has been building strong relationships. They're allowing us to work with them. Yep, and work with them to help build out. So what is being built new to Maxis is actually really cool. And the goal is, when we build this out, it is going to be available for other counties across, because we have to do it with the state. We cannot build without the state because these are state systems. Min benefits, we have shared with them, Reggie has provided a list to the state around what are the components that we think would be helpful, because residents, it would be helpful for a resident to, when they're filling out min benefits, to know what they may or may not be eligible for, or to clearly check or provide some additional information. It's right now coming as a PDF document for min benefits for us to then put into Maxis. And so we are advocating with the state around that. The state did receive, I believe, in the last legislative session, system modernization funding. We are working with counties at the table with the state with some very clear, aligned priorities that we think are important and are even more important with what's happening right now at the federal level.
As much innovation as we can.
Yeah. Thank you. Yeah, Commissioner, I do want to follow up with you because I sit on, for AMC and for Hennepin County, I'm the chair of the Performance Council. And SNAP has been one of the biggest headaches we've talked about there too. And in fact, we had the SNAP folks come on and they talked about some of the changes that they are making. It's slower than I would like it to be, but they have to test everything before it launches. But you're right, so I tried to go into the app and do it, and you couldn't even find what you need to bring to the table to put things in. And so it is a broken app. And in fact, before I went on that call, before you were when administrator, you gave me a list of asks, and I got those lists over there. I can tell you that it's been a strain for us to get them to work with us. We have offered many, many times while I have been here as commissioner, and finally they're going to work with us. I'm grateful for that because their rollouts have not been what I would call substantially successful. And so I think there's an opportunity here, and I'm really glad that we will step up to do some of this work together. But yeah, it's been painful since then, and it is a problem. It is. So I want to validate your frustration. For me, I'm just looking at this fund balance page because I always look at the dollars and everything like this, and I'm looking at the page on, I guess it's slide 12, and I'm looking at the fund balance that we're using, and it's alarming. It's alarming to me because I was been here just almost 10 years, and you've only got a couple of years on me, and we saw us dig out of that. And I'm just wondering, how long could we last? And especially in lieu of what's coming down the pipeline, the wave of cuts we hear. What is it? Is that tens of millions? Is it 50s of millions? What's the wave?
Madam Chair, Commissioners, I'm going to look to Assistant Commissioner Betsy David to provide what we're seeing as headwinds potentially right now.
Please.
So what we know is for our 2026 budget, we have incorporated what we knew. Oh, thank you. Into the budget. And so the last quarter of 2026 is where we'll see that decrease in SNAP admin.
Okay.
And we also incorporated any of the state cuts. What will be impacting us from what we know will be in 2027, and it's 80 million is my understanding from our waiver impacts and then the additional SNAP cuts.
Is that the error rate?
The SNAP cuts are the error rate. The waiver is our, as we work with seniors, they're cutting, the state support for that program is being cut. Now, we have staff on a state committee that is working on that within Dunita's ADD department, but, that's what we are seeing.
What's the error rate? What's the other error rate cut?
The error rate, I would ask, is it okay if I ask Reggie to come up?
Sorry, Reggie, I don't know why you sit down.
That's okay. Madam Chair and Commissioners, so the payment error rate is a formula. There's always been a 6% kind of threshold of acceptable errors that states can have, and so there's tiers. At least for right now, the statewide error rate from the last federal fiscal year would put the state at 10%. So that's for statewide would be $80 million. We don't know how that cost will be allocated, if it will. We don't know. As Kareem said, there's going to be legislative session coming up. But if that gets even 10% to us, let's say, because our error rate was similar to the states. So if you look at the state's error rate, 10%, 80 million, based on our SNAP benefits issued in 2024, which was 200 million in SNAP benefits, 10% of that, if it got apportioned to us, would be 20 million just for the payment error rate. So,
Levy points.
so there could be, if we can get it lower, and the states is lower, that it could be down, to a 5%, which would be 10%, $10 million. So again, we're working hard. We have, I will say that we are a little bit ahead of state right now with the data that we get. So we are, and in some ways, because we're at least 30% of the SNAP caseload, when we do better than the state's average, that means we're helping, right? Because of the volume to help that error rate down. So I will say that we're trying to be more proactive. Case reviews, quality assurance, lots of training going on with our staff, right? Commissioner Conley, to your point, like they are just so critical, the work they do every day. So we've been training much more and we know where the common errors are. So that kind of predictive analytics, we think that there's more that we can do from that kind of
Are we limited
data-driven.
by state? Are we limited by state programming or state systems issues?
I wouldn't say that that's a systems issue, but there is a significant role that the state plays in the quality control and the review of our cases and how they send that on to the feds. So it's a very federally regulated program with a lot of oversight and reporting.
Yeah, okay, all right. So going back to just the fund balance, are we going to manage through these next 3 years? Where's the fund balance going to be in 3 years?
So we have, and it is through working with our three primary levers, which is what I have tried to incorporate into our directors' minds. I asked them repeatedly in meetings. Our three levers are our operating revenue, and you can see in the slide 11, I think it is, where you are seeing us optimize that, right? With our admin revenue increase, we do not count fund balance use as revenue.
I mean, money in, I don't know, I just wanted to know where it went.
And in fact, I don't encourage us to think of it as revenue, right?
Agreed.
But as we work through that, it will require us to look at staffing, because that's our second primary lever. That is the lever that we are looking at and every single week, Director Bobby Jackson and I meet. We look at our safety, stability, and our framework for how we make sure that we are meeting residents' safety and stability first. That is how we are approving and pushing hires to Kareem and to leadership to approve. So making sure that we are trying to, as much as possible, reduce our FTE. That is our strongest lever we have on not utilizing fund balance.
So, no, and I appreciate that, but I also know that in past times, we've transferred fund balances from other departments. Can you speak to that?
Yeah, Madam Chair, thank you. Madam Chair, we have to maintain a reasonable cushion to make sure that we can kind of absorb the shocks. And as I mentioned earlier, if you call it a rainy day fund, it's certainly raining. I'd be happy to put together a follow-up that kind of gives more context for the Human Services Fund and General Fund. So we did our rating calls last week. We actually have an updated list ready that we can share. I think what's important to remember is when you look at the county overall and we move money between funds, we have a limited capability to do that. So as you had the conversation earlier around where the county might potentially step in to try and mitigate some of the impacts on the federal government level, a dollar that we put in one fund is unavailable to address an issue in the other fund. And so we do look at it holistically. It is a very coordinated approach. I just want to reiterate again, Betsy and I spend a lot of time together all year round, not just during the budget process, really trying to mitigate and work with her team about where we put resources. I think how we used our pandemic funds was a great example of that cooperation. We moved resources into the areas that were most critical. We've also, as a county, always committed to, when we see ongoing needs, we have to find ongoing revenues to fund those. And so the hard lever is always, I think sometimes people assume the easy lever is the property tax. That's actually one of the hardest levers. These changes as we go forward are going to have property tax impacts. I think that the balance that the administrator and all of you face as you put together proposed budgets with support from all of us in this room are really balancing, how far are we willing to go on trying to reduce costs? Because again, at a certain point, we can't fail to deliver the service. And so that's where that balance comes in. We certainly have, I think, valued our relationship with the state. Sometimes it's good, sometimes it's challenged. I would remind people again, in 2023, the Minnesota legislature and the federal government were both providing increased revenues, increased funding for a number of programs. And now we're seeing a very dramatic reversal of that as the federal cuts take effect and as the legislature deals with their own financial situation. And so fund balance will not solve our issues. We need to think about, and I think Betsy did a nice job of highlighting, they're looking ahead to 2028. That's consistent with our narrative in the general fund. We're also going to be talking about tapering down budgeted use of fund balance. But I will say on a positive note, the county has always, for decades, had a history of underspending our budgeted expenses and over collecting or over optimizing, or however you want to say it in a positive way, our revenues. And so that is something that every finance team across the county needs to be focused on. Every director, every manager, we do need to try to be mindful of our expenses and the taxpayers' resources, and that allows us to hopefully minimize this. And I would just highlight again that chart. Betsy's team has underspent their budgeted use of fund balance. It's a topic of conversation every month. And that'll have to continue until we get to a point where we're slowly growing those back up.
Well, my many thanks, because we're in a really challenging and crisis mode. This is probably the most impactful budget, one of the most impactful budgets we'll do in this year and the next couple of years coming. So it's certainly something I never thought I would have to see. I managed through the downturn of the economy and the Great Recession, and this is much worse. This seems much worse. So I just want to thank my colleagues. I want to thank everybody for all the great work that you're doing and everything. I know there's going to be more conversations around this as we have to move rather quickly on things. And I think we're going to take a break. I'm going to call it 1:40. I'll give you 10 minutes. So at 1:50, we need to get back and for the next portion of this budget. Thank you, everyone. Can people come to the table? Can we restart? Can we restart? Can I get people to the table, please? I'm using the teacher voice now. And you're seeing how I eat my Twix. I know, I heard about that. Sorry. Everyone, I need quiet. I need quiet in here to start the meeting again. We have a lot to do. Oh, you're doing the clap thing, yeah.
Something, I don't know.
Okay, thank you, everyone. I know there's a lot of conversation because there's a lot of things going on here, and it's really great conversation. We'll have time after this next budget briefing to go over that. We're going to start around the room because there's a whole lot of new people at the front of the table again. Debbie Gotel, Hennepin County Commissioner.
Irene Fernando, District 2.
Angela Conley, District 4.
Kevin Anderson, District 7.
Marion Green, District 3.
Joe Matthews, Chief Financial Officer.
Jody Wentland, County Administrator.
Kareem Murphy, he, him, his pronouns, as Deputy County Administrator.
Kimberly Spate, CEO at North Point Health and Wellness Center. Good afternoon. Good to see you all.
Andrew Baker, Medical Examiner.
Sarah Howley, Public Health Director. Kara Severson, District 7. Binta County, District 4. Sherry Sullivan, Deputy Clerk.
Okay, so we will reconvene, and we have another hefty budget briefing. Administrator Wetland, please.
Thank you. Chair Gotel, Commissioners, we are here today with the Health Line of Business Leadership Team to share the work across the Health Line as it relates to their 2026 proposed budget. I will turn it over to Deputy County Administrator Kareem Murphy to get us going. Thank you.
Thank you, Madam Administrator. Here, next, for today's briefing, we'll provide some introductory remarks. Our Chief Financial Officer, Joe Matthews, will provide a high-level budget overview, and then we'll hear from our Health Line leadership about its respective priorities. Here is the Health Line leadership team. Due to time constraints, today you will be hearing from the Medical Examiner's Office, North Point Health and Wellness Center, and Public Health. The Health Line leaders from Hennepin Health, Safe Communities, and System Design are here and available for questions during the discussion portion of the briefing. The Health Line of Business serves residents in a variety of ways. The intent of this slide is to highlight a few examples. More than 3,300 or 33,000 members of Hennepin Health, more than 5,000 patients treated annually at North Point Health and Wellness Center. If you like my nice white teeth, I get my dental care as well as my primary care. And more than 99% of on-scene responses in under 1 hour from the Medical Examiner's Office. These services are all part of the work this line of business does to keep residents safe, healthy, and thriving. I'll now turn it over to Joe Matthews, Hennepin County's Chief Financial Officer, to provide an overview of the Health Line of Business budget.
Thank you. And I'll go through this fairly quickly. I know we have a short time. On the operating budget, I just want to highlight that overall, we have a $611 million budget for this line of business. It's a 33% increase. I just want to call it a couple specific items. The main driver is really Hennepin Health, and that is due to increased enrollment, and we can talk more about that as we go through. That's a positive. They are stepping in and meeting the need for those clients as other areas, other providers may be stepping back. Hennepin Health is our insurance provider, by the way, not to be confused with Hennepin Healthcare Systems. Health administration also has a large percentage. That's really reflecting 5 positions being moved from other departments and organized under health administration. So that's ultimately a net even for the county, but it looks like a large number there. SARS, I just want you to be aware that that is where we pay for the evaluation of various medical exam kits. The state of Minnesota had been providing an appropriation for that. It continues, but that appropriation is not keeping pace with expenses. And so we are adding funding back. This is substantially less than we used to budget for this area. So I just want to acknowledge that the state is still providing meaningful financial support, but we're also stepping in. And then the last item I want to highlight in here is the Hennepin Community Healthcare. That is where we are financing the uncompensated care at HCMC. That is the county's budgeted contribution. And that is remaining flat at 38 million, which it was increased to 38 million from 28 million in 2025. Property tax, if we could jump to the next slide. Again, You'll see here the percentage increase for health admin. It's not it looks like a larger percentage because we've more than doubled the number of positions budgeted there. From restructuring, I want to highlight that Hennepin Health does not receive any property tax funding. They are primarily funded through federal revenues and through Medicaid and through the state. There's an interaction there. And then also, again, you see a large percentage increase for SARS. For North Point, that is really driven by just increased personnel costs and other costs associated with operating that clinic. And then the total property tax there is $63.9 million, up about 5.1% over the prior year. If we can go to the next one. And then here's the staffing. There is a overall 2% reduction in staff within the line of business. I want to highlight the two most significant areas are really the medical examiner, which is reducing 2 vacant positions, and North Point Health and Wellness, which is also reducing some vacant positions. Just as a theme in the entire county budget, we worked with all departments. If there were positions that were vacant that they expected they could operate without or did not anticipate to fill, then we chose not to budget for those where possible. And with that, I will pass it along back to Dr. Baker.
Welcome, and turn the mic on, somebody. Thank you.
Thank you. Madam Chair, Commissioners, it's a pleasure to be here this afternoon. I'd like to briefly share some data and some trends and some accomplishments from the Medical Examiner's Office. Overall, reportable and accepted cases are relatively stable with expected annual fluctuations considering the total number of deaths in our jurisdiction. Incremental declines in non-natural deaths are not statistically significant. However, decreases in homicides, drug-related deaths, and motor vehicle fatalities are encouraging and contributed to fewer scene visits and autopsies in 2024. More about those drug-related deaths in a moment. If I could have the next slide, thank you. The number of autopsies in 2024 declined to pre-pandemic levels under our modified autopsy guidelines that we implemented to accommodate the spike in drug-related deaths during the COVID-19 pandemic. With the onboarding of another pathologist this year in 2025, we have resumed performing more autopsies on apparent natural cases, collecting valuable public health data. These changes will have an expected increase in total scene visits and death investigations, as well as bodies transported to the morgue, which we are fully prepared for. In 2023, drug-related deaths peaked, but since then have been on a downward trend both in Hennepin County and nationally. Still, drug-related fatalities in Hennepin County are 80% higher than 9 years ago, when the rise in synthetic opioid overdoses, and by that we really mean fentanyl, began. With rare exception, investigation and certification of these deaths require a complete death investigation, full autopsy, and comprehensive toxicological testing. Drug-related deaths still account for more than 1 of every 3 autopsies performed at the Medical Examiner's Office. Our final slide highlights some of the accomplishments of the Medical Examiner's Office. Due to our time constraints, I'm just going to highlight 2 of these. Just weeks ago, the Medical Examiner launched a new public data search tool on our website. This tool makes public data on decedents more accessible than ever before to residents, researchers, families, and the media with just a few keystrokes. It eliminates the need to submit a request for public data, it's entirely automated, and it reduces the amount of staff time needed to fulfill public data requests. Finally, by leveraging our growing anthropology services, we have enhanced partnerships with the Minnesota Missing and Murdered Indigenous Relatives Office and Missing and Murdered African American Women Task Force using federal grant funds to apply for new forensic techniques to long-term unidentified cases. We are planning Minnesota's first annual Missing Persons Day for the summer of 2026 to bring attention to these cases and assist families of the missing and unidentified. I don't know the exact date, but it will be in 2026.
That's wonderful. That's great. Wonderful.
Great. Good afternoon, Madam Chair, Commissioners. I'm Kimberly Spates from North Point Health and Wellness Center, and I thank you for the opportunity to present North Point's proposed 2026 budget. As healthcare coverage tightens and economic uncertainty grows, more residents are turning to North Point for care. That's not a crisis for us, it's really our purpose. So North Point is an anchor in community-based healthcare. We sit where health and human services meet, making sure that every person, regardless of income or circumstance has access to care that is comprehensive, culturally responsive, and connected. When systems struggle to reach people, North Point meets them where they are with both compassion and results. So let me share what your investment has delivered this year. Next slide, please. In health initiatives, our culturally responsive healthy pregnancy program achieved 100% healthy births among 35 Black women. This is significant when Black women are 3 to 4 times more likely to die from pregnancy-related causes, regardless of income or education. The Women's Health Initiative, Heart Health Initiative, supported by Public Health and Commissioner Conley, brought together 2 cohorts of African American, Black, and Indigenous women who have experienced heart attacks or strokes. These women are learning heart health strategies, connecting with local experts, and supporting one another. We look to expand this initiative next year. Our Flavors of Health program, a partnership with Hennepin Health, uses our new teaching kitchen to combine clinical care with nutritional education. Patients managing congestive heart failure, diabetes, or pregnancy receive 8 weeks of groceries and cooking classes tailored to their health needs. Through the Health Resources and Services Administration, North Point received 2 national awards for making care better and easier to reach and to meet all of our operational site visit requirements. We're not only providing excellent care, we're opening doors so people can benefit. In terms of our financial and operational performance, we're seeing real progress. Clinical revenues have increased by 11% over last year. Patient revenue has surpassed targets by 12%. We've reduced total expenses by 2.2%, even with the inflationary pressures, while managing the same 7.7% increase in staffing costs that have been experienced across the county. Through enhanced enrollment and payer adjustments, uninsured patients decreased from 33% to 26%, a 7% increase in patients with insurance coverage. The organization is breaking even for the first time this month and is on track to reduce reliance on property tax dollars in the months to come. So as we look into 2026, our 4 priorities are focused on workforce stability. So despite ongoing workforce challenges across healthcare, we continue to make strategic progress. We anticipate ending 2025 with a 6% vacancy rate, a significant improvement. We've trained and hired new providers and support staff and continue partnerships with the University of Minnesota Dental School, MNSCU, St. Kate's, and Augsburg College to build a diverse pipeline of healthcare professionals. Our $5.7 million operating budget for 2026 represents a 3.5% increase over last year, and our proposed budget also includes $15.9 million in property tax that will support 280 FTEs. Rising non-personnel costs, pharmaceuticals, lab services, and interpretation are outpacing our ability to grow revenue through productivity alone. Patient service revenue is projected to increase by 14% by the end of this year, but that growth alone cannot offset structural cost pressures. To strengthen our position, we've implemented several strategies: a 5% reduction in non-operating expenses, expansion of payer contracts to diversify revenue, and improvements in revenue cycle management, specifically targeting denials, registration, and coding accuracy. We're aligning operations with clear productivity benchmarks to maximize resources while maintaining high-quality care. Our community board is leading our strategic planning process, ensuring community-driven direction and accountability. The plan builds on a recent community needs assessment and incorporates the changing realities facing those we serve, as you all have mentioned previously, including shifts in Medicaid and SNAP that impact access to healthcare and well-being. We're also leaning into operational efficiency. We've launched 2 major initiatives: dramatic performance improvement in partnership with FQHCs across the U.S., and excellence and equity through quality improvement, our internal framework to align data, systems, and people. In 2026, we'll focus on measurable improvements in patient outcomes, particularly chronic disease and behavioral health. Our electronic health record enhancements include full integration of dental into Epic, ensuring better coordination of care and seamless experience for patients across all service lines. Next slide, please. Challenges and opportunities. We are realistic about the landscape ahead, very realistic. National policy changes will increase the number of uninsured patients. Pharmacy margins are narrowing due to federal drug prices mandates for medications like insulin and EpiPens. And we've experienced reductions in prevention and youth development funding that directly affect the social drivers of health. But those challenges only clarify our purpose. Through our dramatic performance improvement, we are reducing wait times, improving access, and increasing appointment availability. We're strengthening community partnerships that address social drivers of health and increase our capacity to serve the community. We are also investing in care coordination and front-end revenue systems to ensure patients receive the right care at the right time. North Point is not waiting for the system to evolve. We are building the model of what equitable, community-centered healthcare can and should look like. Our mission has always been clear, partnering to create a healthier community. And right now, that mission has never been more critical. Consider what this means. 24,000 residents served last year, 12,500 immunizations protecting our community, over 10,000 diagnostic tests catching problems early. And through our sliding fee program, thousands of people managing chronic conditions are able to do that with medications that are affordable. But here's what really sets North Point apart: our integrated care. When someone walks through our doors, they're not shuffled between systems. Medical, dental, behavioral health, pharmacy, and human services all work together, all focused on the whole person. That's how we turn your investment into something transformative: healthier residents, stronger families, and a more equitable Hennepin County. So together we can continue to deliver health equity and hope for our communities, and we're excited about the opportunity to do that in 2026 and beyond. So thank you.
Chair Gattell, Commissioners, thank you for having me. Sarah Holly, Director of Hennepin County Public Health. I just want to continue the positivity that's been placed in this space after a very, I think, challenging morning or early afternoon. And so again, for public health, the following accomplishments and priorities are an important part of the county's goals of achieving disparity elimination through the 7 domains. We've done this through resiliency in action, responsive prevention and person-centered care, and building collective power together in public health. Resiliency in action demonstrates public health's ability to prevent, mitigate, and respond to unmet needs in community that boldly advocates for an equitable and transformative public health system. We do this in public health by building alignment and continuity across public health services. That means our programs, staffing optimization, maintaining a prepared workforce ready to respond to emerging needs and infectious diseases. I want to pause for a moment and just thank the incredible team of public health, the 404 staff that we have in the department, and the work that we're doing to really mitigate the impacts of federal changes and the existing shutdown. Also strengthening our data collection and evaluation through our Community Health Improvement Plan, which I'm really excited about, our Community Health Assessment, also known as CHIP, is launching a new plan in January of 2026 to improve mental health access and access to basic needs, built through months of community-driven planning and cross-sector collaboration. And for our climate action efforts, we are conducting research on health impacts of air pollution, which I think is really important, and are updating the cooling options map to support community access during cooling sites and during heat events. Next slide. Responsive prevention and person-centered care are central to how we eliminate disparities in Hennepin County. Public health continues to maximize our core public health services and programs through service areas within the department to prevent the spread of disease, protect against environmental hazards, prevent injuries and violence, promote and encourage healthy behaviors, plan and respond to health emergencies, and ensure quality and accessible health services. We have increased access to preventative services and whole person care. This includes providing a positive experience for our customers and our clients and our partners. Also launching the Red Door Services Community Outreach and HIV Prevention and Status Neutral Team, which provides whole person care to young Black men ages 15 to 34 years old in communities at high risk of acquiring HIV. Through our public health nurses and home visiting team serving more than 10,000 people and 2,000 families in 2024. It also includes WIC, reaching an average of 14,983 participants during calendar year 2024. As mentioned earlier, we expect to see a 5% increase in average participation in 2025 and are monitoring and planning for an increase in application and redemption of benefits due to the federal shutdown and impacts on SNAP benefits. And through our public health clinic, taking care of more than 10,000 people and more than 22,000 visits in 2024. In addition, a core part of our work is to invest in health communications, community engagement, and outreach. This year, we engaged over 550 community members and 50 community organizations participating in department strategic planning process, which we hope to share with you soon. Next slide, thank you. Building collective power together is really the only way we should do this work. This includes optimizing partnerships for improved health outcomes and disparity elimination. We have done this in so many ways, including birth justice, heart health, healthy aging, our HIV prevention work, and our continued investment of $17 million with over 70 partners. Fostering innovation and transformation to address unmet health needs in Hennepin County is also essential to disparity elimination. This includes deepening our investment in culturally specific services and supporting community-led solutions. Due to time today, I'm going to make one note of how we're doing that. Through our Heart Health Initiative, Your Heart Beats for Generations campaign reached over 108 million impressions, 90,000 ad clicks. Hopefully I'm making comms proud with that. With Facebook and Instagram engagement well above average. Since the launch, 2 million has supported the ad campaign, clinics, community orgs with care coordination, home monitoring, physical activity access, and culturally specific support. Over 5,000 people have been reached through events and clinics building trust this year. Next slide, please. Commissioners, an HIV outbreak in people who inject drugs and were living in encampments was declared in Hennepin County and Ramsey counties in 2020. In response, the Healthcare for the Homeless Street Medicine Program expanded to deliver high quality and extremely low barrier medical care to those impacted. This slide underscores Healthcare for the Homeless's efforts to reduce HIV, particularly in people experiencing homelessness, and ongoing commitment by public health to ensure we are meeting the unmet needs of our residents. They have greatly increased their efforts in HIV prevention, early detection and screening, and treatment with rapid access antiretroviral therapy. HCH also recognizes housing as healthcare. This is for this population and have housed 49% of participants participating in the Ryan White program. HCH had significant increases in pre-exposure prophylaxis or PrEP prescriptions to prevent HIV from 2021 to 2024. And they are prescribing more antiretroviral or ART medications to treat HIV than ever before. HCH's mobile medical team delivers medications and care where the patient is at in community, including those staying outside. Amazingly, 83% of their panel of HIV plus patients has achieved an undetectable and therefore untransmittable viral load. HCH does not do this work without robust partnerships with community partners, including NAC, Clare Housing, AID CDC, Southside Harm Reduction, Hennepin Healthcare's Infectious Disease Clinic, and the HCH Board, and many more. Next slide, please. I just want to take a few more minutes to briefly cover some of the challenges and opportunities ahead of us. Some have been mentioned earlier, so I'll skip over that information. Just earlier, we talked a lot about the challenges of SNAP and the increased need of community food supports. While federal funding is decreasing or stopped, unfortunately, at this point due to the federal shutdown. And we know we have an opportunity here to invest in community programs that provide healthy foods that are accessible and culturally appropriate. We are currently doing this through a $4 million investment from this board of public aid to 35 food shelves in communities, helping deliver over 500,000 interactions per quarter in distributing thousands of pounds of culturally appropriate food. Amid funding challenges, county support help stabilize services in community. A new food security plan, shaped by input from 50-plus partners and staff, is near completion. Next slide, please. We are also preparing for an increased need for state and local government to provide previous CDC activities such as disease surveillance, population health data, and health recommendations. With changes in federal priorities, functions states and local public health agencies have counted on now no longer are being supported at the federal level. That doesn't mean that the need goes away. However, functions such as disease surveillance, population health data, and evidence-based health recommendations are more vital than ever to keep our residents safe and healthy. These typically are out of scope for local public health agencies. However, but at this time, we have an opportunity to partner directly with community to instill the trust in public health. And I can't stress that enough. We need to continue that journey of making sure that our communities trust in your public health department, and specifically Hennepin County Public Health. We are working with community to understand their concerns around critical public health tools such as vaccines so that we can meet their health information needs, welcome their questions, and help them make decisions that protect themselves, their children, and communities. Other challenges we anticipate include the unexpected and further federal state budget reductions with grants or direct payment at a critical juncture where we have a growing need for services. At the same time, these challenges present opportunities. We are directing our existing resources on critical and core public health services with a focus on disparity elimination and prevention. We're working to optimize our capacity for core public health services and programs and community support, and advocating where possible to policy changes that serve our clients and our patients. I want to thank you for your time today and for your ongoing commitment and support of Hennepin County Public Health and our vision to improve the health of all county residents. Thank you.
Chair Cattell and Commissioners, that concludes the Health Line of Business presentation.
Thank you. Commissioner Anderson, are you prepared?
We'll see. Thank you, Madam Chair. Thank you for the information. I'm going to try to be really brief. You're welcome. I'm going to focus, I think, mostly on the public health portion of it. Not that I don't care about the other work, but I really appreciate the presentation. So thank you. Now, with everything that's happening at the federal level around public health and disincentivizing vaccination, disease detection, I mean, the work at the CDC and research and everything that's happening there. What is, like, can you speak a little bit more to the deficit of services that are being that we're going to be missing? And in what way or how much are we able to compensate that with that through internal talent? And what might, well, like, what are we looking at in terms of kind of not necessarily decrease in funding per se, but like they eliminated entire departments and like we can't, I've heard of people not being able to talk to somebody at CDC anymore. Can you speak a little bit more to that kind of impact and how we are responding and how we're able to kind of not take over, but what we're doing?
Chair Gattell, Commissioner. So just, and I may have Deputy Director Abel come up and talk about the vaccine strategy that we're building. So disease surveillance, as I mentioned, because CDC is so impacted by the changeover of leadership, departments like, you know, with just within HHS, SAMHSA, right, which impacts not just public health, but health and human services. And so really relying on our local data is going to be key here, and really working strategically with the Commissioner of Health and MDH to better understand even how we manage, monitor, and do surveillance around infectious disease. Last year, I think on my first day here at Hennepin County, we declared an outbreak for measles. We're continuing to respond to measles here in Hennepin County. And so we're working to optimize our capacity within public health, not just with our amazing epidemiologists, if you're out there listening, but to really stretch our capacity. And so we are, as the largest local public health department in the state, relied on for expertise, for capacity, for contact tracing. And so I'll have Deputy Director Abel come up and talk about our vaccine strategy. And I just want to say a couple things. We are going into 2026, we are going to be implementing the SHAPE survey. We have our community health assessment. We have state-level data that we're relying on the state to really continue to monitor, produce, and that's why I also mentioned the importance of data collection at the local level. So the reliance, Commissioner Anderson, on federal data, even for food security. I think there was a headline around that data not being available at the federal level. So we're really going to be relying on local partners, local information, and the relationships there. So I'll turn to Deputy Director Abel to talk about our vaccine strategy, because that's another concern that we have both locally and statewide.
Sure, Chair Gattell, Commissioners. Probably the most recent example was what happened at the federal level with COVID vaccine recommendations. So we very quickly mobilized our excellent epi team and our vaccine team and our clinical staff, and we were preparing to figure out what we would do for our recommendations at our clinics. And we were very, very lucky and fortunate that MDH, the state, stepped in, and they're the ones that filled that gap to say, here's, based on all the clinical information that's available, here's who we think should have COVID vaccine. So we're following that guidance now. And then whatever would happen at the federal level, whatever decisions would be made, we would rely on our experts and our MDH partners to go forward. So regarding our vaccine strategy, what we've been doing now, I think since COVID, so it's been a while, is we're partnering with community. So instead of having these max vaccine events, we have these smaller events. We just had one last night. I think 45 kids were immunized. So we're going into schools, into community areas and doing vaccines that way. And we're partnering with a community agency to give those vaccines, multilingual, multicultural. And we really think the strategy of these smaller events and partnering with schools too, and the school nurses, is really helping raise our vaccine rates.
Is there opportunities to share our expertise with, like, throughout the state? And is that, like, I know that doesn't happen for free, but is there opportunities for us to, like, build out relationships, either joint power agreements or something along those lines, being that we have the infrastructure that may not exist in other smaller local public health agencies?
Yeah, I think that, Commissioner Anderson, I do think that that's possible. I think that that would really take a statewide coordination. And that kind of goes to Mr. Murphy's point, is I am always wondering where we step in and where we step back.
Yep.
I do think we have a lot of course, with Hennepin Healthcare, with our partners in Hennepin Healthcare and the clinic and hospital system, we have a lot of, again, great expertise there that we could pull on, that we could impact more of the community, because Hennepin Healthcare, of course, has a wider reach than just Hennepin County. So I think there's a lot of opportunities in that way.
Chair Gattell, Commissioner Anderson, Commissioners, I'll just add that I think our amazing federally qualified health centers in the community, our community clinics, that's spaces where we want to make sure that our residents are connecting in with for vaccines, for heart health, for WIC, right? We have, I think, an incredible opportunity there to do more work. We have a mutual aid agreement in the metro area and across the state around, if in fact, incident command is declared, if in fact a public health emergency happens, along with emergency preparedness, that we can always leverage. And so I just want to reassure you that I'm in constant contact with our Hennepin County local public health agencies. We're building more relationship with our cities also that do not have local public health agencies, to make sure that we're getting information out in real time and that we have these opportunities to connect with community about these core public health services.
I think, Commissioners, just another thing to add is we did build into our budget money for vaccine. So right now, vaccines that are approved nationally get paid for locally through different funding structures. So because that was so unsure, we did build some extra money for that.
Commissioner
let's see. Sorry, I'm still really working on trying to figure out who I can bug at the state level.
No, that's right.
I really am like a worker bee over
Well,
here.
thank
You hear me
you.
pounding. I promise you I'm sending emails to people. I'm very fired
We
up
need your
about this.
advocacy.
Yeah, okay, so you're all doing great work. By the way, I found out about what's the, I asked a question, you weren't here, about the capital, it was like the mold that you were doing, 3D mold.
3D.
Very cool, very cool. All doing great. North Point is just awesome, doing great work. There was one thing I had a question on, and I totally moved past it. Oh, Hennepin Health. Okay, so at the rate that it's growing, where was that sheet? It's a lot. It's a lot, and we have Medicaid changes coming, unless something drastically changes, which I really hope it does. Right before that. It's the rate was like 42%. Yikes. So, can we tell me about projections? Because I think, I was just looking up too, as I try to remember how this works. I want to know if we've done a financial projection. I want to know if we have rate adjustments that we've worked with DHS on. Because that sustainability of that, we have to have some hard conversations at some point. Otherwise we're gonna be passing a ton of this, like, we need the state to help us. If more more insurers are not going to insure people. It can't just be Hennepin County being like, yes, we will help everybody on this one specific issue. So I'm curious what your thoughts are as you're thinking about this.
Madam Chair, Commissioner Edelson, Mike Herzing's here, Chief Executive Officer of Hennepin Health, and I think he can provide an overview of what the growth is and the work that you're doing around that.
Sure. Let me make sure these mics are on. Madam Chair, Commissioner, a good question. Now, the 42% on there, I want to make sure that that's related to growth of our costs. So our revenue, which has gone up as a result of our membership, and then the claims expenses as a result of that increased membership. What we've seen so far this year is about a 16% increase in the number of members we've got. So right now we're taking on around 500 to 600 new members a month, which has been pretty steady for the last few months. Right now we're projecting that to continue into next year. There are some things that could impact that we're trying to get clarification from the state on, and that is whether the plans that have left the Hennepin County market will come back into the market. That would adjust that number perhaps down as much as 50%. Now, what we know is coming in 2027 are federal changes that we talked about related to work requirements, and we're trying to ascertain what impact that will have to our membership and the overall Medicaid membership in the state. What we don't know right now is what allowances the state is going to look for that will make people not have to meet those work requirements. We may not know that until the legislative session happens in the spring. So we are keeping a close eye on this. What we do know is we've worked with them on our rates. We feel like our rates for 2026 are going to be adequate to allow us to continue with the current growth trend that we're seeing, and they will leave us in a good position for 2026.
That's helpful.
So there's a lot of things that are happening really weekly that we're trying to just make sure we're tracking with DHS around some of this growth and what's happening in the market.
Anything else?
No, I'm good. You can go.
Okay, Commissioner Conley.
Thank you, Madam Chair, and thanks everyone for the presentations. Really good. I'll go in order. I think that I have one question, but mostly just some appreciation for the work. I have been waiting on page 12. I don't know what slide this is, slide 12. I have been waiting for the numbers to go down on the drug-related deaths since 2020. So to see where we're at, I appreciate though, Dr. Baker, the caveat that you gave to this number, right? Like there is still a heavy presence that's happening, but we have just skyrocketed. Last year, 532. So this dip is incredible. And like, let's get back down to pre-2015 levels. I'm hoping that work that we have been hearing about through the budgeting process is work that will help us get there. And I appreciate you including this trend when you produce your budget, because it's very telling. And seeing that number go down just gives me a lot more hope than I had seeing the number last year. So thank you. I also want to shout out on slide 13, leveraging talent acquisition initiatives to increase diversity in the ME workforce. I'm just grateful that you're still committed to that work. And I know that you're holding 2 vacant FTEs, but I know that this type of work is something that you value, that we value, and you're receiving awards for it. So thank you for that. For North Point, I can't say enough about the incredible things that we are happening, and I appreciate the way that you framed what's coming down from the federal government and what your charge is, right? I really appreciate that framing, because it can be heavy, but it's what you're called to do. I will tell you that we've kicked off the 3rd cohort of the Heart Health initiative, and I appreciate that you're continuing that work, because that is one of the core pieces, I think, is bringing women together who have experienced these things to every single week in sisterhood, right? To learn how to cook better, to just share our experiences with each other. Every time I kick off a cohort or go, there's just this vibe, I don't have another word for it, that is, the energy is palpable, and it is, I will see you all next week immediately, because like, we've been waiting for this. So thank you for continuing that work. And for public health, I'll just say that I know that there is a bigger need for food than we can meet, but I very much appreciate that we are keeping it steady, right? That we are saying, for what you receive this year, you will receive next year. And hopefully, there will be more opportunity after the year turns. And I appreciate that this is something that we don't cut. I've said it before, food, housing, these are untouchable things to me. These are things that keep people alive and thriving. And so those aren't areas that we can take from, especially when bigger levels of government are taking from it. I'll leave it at that. So thank you for, I think, prioritizing some really good work. The only question that I had is I wanted to get a clear picture of the public health budget, and I think it's in the human services book. It would be nice if it was in the health book, right? So it took me a while to find it, but I think on page 16 of the human services and public health budget book is the public health budget. So it's got the 2026 proposed budget, a drop of 10%. FTEs, it looks like 76. So can somebody walk me through that? What am I missing with the dollar amount and FTE drop? Are those vacant positions, just like we've been talking about for this afternoon? And then the dollars, it looks like we had an adjusted budget for public health of 86 million. That's dropping to 77 million for 2026. That's a almost 10% change. So I'd love to know what's driving that, because I don't see, what's different about the public health budget is I don't see the significant differences box that would kind of explain that out for me. So.
Madam Chair, Commissioner Conley, I'd invite Betsy, Interim Assistant County Administrator Betsy David, up to respond to that. And as she makes her way, I just want to explain one thing. What we tried to do in organizing the Human Services briefing and this briefing is around the funds out of which we largely
So this is
operate.
related
So
to
this
the
is
Fund 20.
Yeah.
Okay.
An hour ago was a Fund 20 presentation. This is a Fund 19.
Fund 10.
Fund 10. I'm still new here. Thank you.
Okay.
Ms. David.
Fund 20, Fund 10.
Thank you, Commissioner Conley, and thank you for the question. We've reviewed the FTE decreases. The primary decrease is due to an actual program within Ryan White, which is the largest decrease in FTE. The other decrease is net of our vacancy, which we have budgeted, is not the entire amount here. We've actually reduce the amount of vacancy within the public health budget, so the total is not that FTE difference. If possible, can I get back and answer kind of where the FTE decrease within public health is?
Sure.
Does that seem reasonable? Okay.
Yeah, and Madam Chair, I think that would explain then the almost 10 million difference in budget?
Yep.
Is that, okay.
Yep.
So which Ryan White program ended?
I would have to ask. I don't know.
Director Holly.
Thank you. Madam Chair, Commissioners, I'll invite Stephanie to come up, Deputy Director Abel, to talk about Ryan White. That is under her purview right now. Yes.
Stephanie Abel, Deputy Director with Public Health. Thank you for the question. There was a small reduction related to some state funding change. So we have two funding streams for Ryan White. One is direct federal, and then one is state pass-through. And then there was the state funding cut that cut a small amount. The majority, actually all, except a small percent for administration of our Ryan White funding, goes right out to community providers. So we were able to do some different adjustments with our federal funding to make sure that those community providers could continue to have flat funding.
Good.
Nice. Mr. Matthews, go ahead.
Madam Chair, I just also point out, there's not a huge blurb, but on page 19, there is a short summary, and a big highlight, public health has a reduction of 7.7 million in federal and state revenues in their area, and so.
Oh, I had a question there.
Yep.
Yes.
So, well, I guess I teed it up, I'll hand it back to you.
So yeah, I highlighted that, thank you. There's a little bit, and I guess, the only question I had is about the cost. It says the division reduced services and contracts partially due to the federal and state revenues, right? But it also says there's other costs that were prioritized and managed with resources available, which, increased the use of fund balance. So I just wrote, what other costs?
Yeah, Madam Chair, I think in response to Betsy's follow-up on the positions, we'll just
Yeah.
give you all more detail on what's in that budget. What I would say is, again, this is an example where when we've had to make staffing reductions or prioritize, so the increase in fund balance is basically a recognition that we can't cut dollar for dollar with lost state and federal revenue. There's services that are critical. And so we'll just give you a more detailed, summary of both the expense side and the revenue side as far as what's happening, and then staffing.
That's helpful, thank you. Just because of the really important work that goes into public health. It's our first line of defense against, we just heard CDC cuts and like what's not being tracked and what is, and we are doing that. Even for places within our county that can't do it themselves, we are that arm, and so it'd be helpful to see that level of detail. Thank you, Madam Chair.
Thank you. Commissioner Fernando.
Yes, thank you, Madam Chair. We're so close to completing briefings. Thank you to you, Madam Chair. Congrats to Jody and her deputies, trademark coming, just kidding. Okay, I'm gonna go in order. This is a really cool set of presentations together because of the journeying over the last handful of years. And so when I joined the county board, we did not have a new medical examiner facility yet. The current facility, Dr. Baker, your commitment to staffing, really heartened to hear about the event you're discussing next year. So it's not that I don't have questions or demands now, it's just, I pre-distributed them to you and others in previous years. And so I want to commend you for that, and I thank you. You always came with very particular sets of needs. It's here to hear that the additional pathologist has come on. So you've been specific, and this is the type of data that we have been waiting, these are the type of outcomes, I should say. You've always provided the data. I am still intrigued around what data analysis we can provide for when, not everyone comes to, when there's an event, people will be at the hospital, or sometimes people end up at the medical examiners. And so I'm curious around how our broader system can, what insights might be possible from a data perspective. So these are all just comments. I know we're nearing the end here, and I wanted to thank you for your commitment to receiving feedback and responsiveness, specifically with feedback that I've offered. North Point, also where I get care when I get care. Yikes, I know I'm gonna make an appointment. So down the street, everyone you already know, North Point is the spot. I mean, also a new facility last year. whenever a new facility is made, it is always wondering, will it kind of meet the needs? And if you're welcome to come to North Point. It is a community center. It's a living room. It's somebody's grandma's kitchen, so you better watch out. And so really thinking about that type of embeddedness in terms of integrated care is really inspiring for me. That's also true with healthcare for the homeless particularly by way of its staff and how staff stay so connected, but of course the physical home that has been able to be provided to North Point. So immense gratitude to the community board. The community board is tough. I mean, I am not the one asking the hardest questions. You can for sure ask Bay back there, who's the finance director. I am not the most activated board member, so that's cool. And I just can't thank you and the workforce enough for the integral role you play in the broader community, but really districts 1 and 2 on the north side. And then from a public health perspective, it was March of 2020 or May of 2020 when Commissioner Conley and I were privileged to declare racism as a public health crisis. And that's really when I came to understand differently the expertise and lens and really the visionary way by which public health approaches its practice. And I've been heartened to see that embedded from a data perspective and from a outcomes perspective across the county. And so I just want to amplify what you said on that very last slide. The very first briefing, I opened with this data charge that we need to be tracking our own data. Because I am really, really nervous at the time, especially, but now it's been validated, that we're just not going to have data. It's really, it's unnerving to me. And then, no one thought the first pandemic could happen. And usually in community, when I say we need to be prepared for, future health events, future pandemics, and the most common response I get from residents is, well, we won't be informed of one because the CDC is not here. And that's a really, it's a really stark comment to receive over, and not as a joke, resident after resident, town hall after town hall. And so I really appreciate the charge or the call out to that. And that is something that is quite heavy on anyone who cares about data and outcomes. And so I appreciate what Commissioner Anderson was saying about the rest of the state. If I may be so direct, a place we should begin is Minneapolis Public Health. We have not been able to be successful. The measles response is an example where the county sought to ensure that our efforts were aligned and effective with respect to measles. And both the city and the state were not receptive at that time to that type of concept. And so it's not just a conceptual sharing, like how are we really linking up the public health authorities' charges with the other public health authorities in ways that are meaningful and streamlined to residents. One could call that kind of under the consolidation charge that myself and others have stated, but it's not about consolidation when it's been taken away from the feds. This is work that should have been done elsewhere, not unlike census in 2019 and 2020. We locally invested in census, and thank goodness by 26 people kept our delegation. And so that's what I'm hearing now. But immense appreciation for everyone here. Congrats to your first full budget, not quite yet done, but still administrative well. Thanks, Madam Chair.
Thank you. Thank you all so much. Really exciting and super important work, clearly. Probably my biggest comment is similar, and if any of you were in the room for my comment around the human services budget, which is just really wanting to understand the pain points that you're all experiencing. And I appreciate that there was a talk of positivity. It's tough to find these days, but I do want to understand better the challenges that you're facing so that we can be honest advocates with the public and with our elected partners. I also wanted to name Hennepin Health. It's gone through, sort of ups and downs with enrollment, et cetera. And I don't have a question about it, but more just want to express my interest in keeping an eye on it. I think it's continues to be you know, hotbed of innovation and a place that new and different things can be tried and are tried. It has that history, and I want to make sure that we're able to continue doing that, and things are looking good. And I also appreciate that it was mentioned, will the programs that have bailed in this space, they're essentially their competitors, come back? So just wanting to keep an eye on that. And then I think my final note was just to express broad support for this great work. So thank you.
Thanks, thanks. I guess it's back to me here, and I gotta try to keep us on time if I can. First of all, to North Point Health and Wellness, I've been able to visit many times, all of us have, to the great groundbreakings. The last administration secretary of health was here. We know how impactful this is to the community. We know this is the model that we need to carry through. And even with the cuts in grants and Medicaid that are coming, you're still holding the ship steady. So that's an accomplishment you should be extremely proud of. And so I just wanted to say thank you very much for that work. On the Board of Health, first of all, I just want to say that some of the Board of Health child well-being work together has been just incredible. We have been working with the Board of Health at the child well-being level to get into homes, to get into the prevention mode. There's lots of times you can get in as a Board of Health nurse to get to that mom or those families and talk to them, find out what their needs are, and circumvent child protection, because they don't want to talk to us. Let's face it, we still have the big bad X on us. But the Board of Health has been able to do that, and that really matters to us. Just kudos to that. I want to say that you continue that work, and it's making a difference, and it matters. The one thing I wanted to talk about, I'm really impressed with the HIV impact and what you're doing and the number of prescriptions we're getting out. I wondered if there were any concerns about these HIV drugs and the costs and the availability. Are we going to see anything happen? Are you hearing anything on the front about some of that?
Chair Gattell, commissioners, I have an amazing leadership team, and I'd ask Deputy Director Abel to come up and talk about that, or Area Manager Don Petroskis, but I think Stephanie beat her to the mic.
Chair Gattell, thank you for that question. Again, Stephanie Abel, Deputy Director with Public Health. This can blend over into more information we can provide you about the 340B program. Okay. But healthcare for the homeless, any federally qualified healthcare center, all patients of that healthcare center are eligible for those medication costs. So it's basically a reduced cost that we receive to be able to provide medications for people.
Okay, that's really good to hear, because that's real important. We made such strides in that. And so then, in general, I wanted to talk about the human services as a whole now, because there's been a lot of concern about the lack of data at the federal level. That's going to come down. The CDC is pretty much demised. I mean, what are we going to do? And Hennepin County is one of the big players here. We're collecting data. We have lots of data. Is there an initiative at the state level to bring some of this data together so we have good data? Is there any talk about that kind of a triage? Anybody?
Madam Chair, Commissioners, I want to mention HTAC. I don't want to keep calling Stephanie up to the plate.
She's really good at it, though.
But and I think we have some HHS partners in the crowd too. But Dr. Winkleman and his team, Hennepin Health Research Institute. I got that acronym right. That's an incredible resource for us. So it's the health trends across communities, information that we collect, and we're partnering with health systems. This has been a data
throughout the state.
Throughout the state. And we're working with health systems, that team at HHS, in partnership with Public Health, because we do have staff within Public Health that help with that process. But the funding for that is critical. And that funding has come typically from the Minnesota Department of Health, something called the Infrastructure Grant. Okay. And so we're looking to work with MDH to help sustain that incredible data source that Hennepin County is leading on in partnership with health systems. And so I think I've talked with Commissioner Conley a little bit about the charge here, but really making sure we can sustain that data source, that this data source is looked at as not only a Hennepin County resource, but a statewide resource. So that's just one really important example of the data that we have here in Hennepin County, but that we work in partnership statewide.
And I'm heartened to hear about the medical examiners, that you're able to do more autopsies on natural deaths, because that adds to the information that we have. And that's impactful too. So I'm really excited about the fact that we could keep some of this data flowing, even if it's just at our state level. And maybe, that's something we could be talking about in NACO, about what we're doing, so that they could replicate this data, because we're all gonna feel the miss of this data, right? So I wanted to end it. I just wanted to say the incredible work we're doing here. It was kind of nice to end on a little bit more of a positive note. That was a pretty heavy briefing before, and I really appreciate every one of you. So thank you very much. We're going to move on to the agenda. Item 2A is approval of the minutes of October 22nd's budget briefing. Do I have a
Move
motion?
approval.
Second.
Is there any changes, corrections? All those in favor signify by aye.
Aye.
Motion carries. So seeing no further comments on this, I would take item 4A is old business, which is a layover motion. This item until 12 noon on Wednesday, November 10th, when we convene with the budget hearing of the 2026 proposed budget to consider the administrator amendments. Oh, that's next. That's after 4A.
Oh, my gosh. Okay, I'll move it. Sorry.
Second.
Sorry.
It's okay, it's been a long day.
Sorry.
All those in favor signify by aye.
Aye.
Item 5, I wouldn't forget it yet, is open forum. Members of the public watching this budget hearing can call and leave a recorded comment that will be played for the board at the next budget hearing. If there is not enough time to play all comments, then recordings will be sent to commissioners. Your comments should be related to the specific budget hearing. Recorded messages will also need to meet all the following standards, which are the same standards for personal comments. Callers will need to state their first and last name for the record. Callers will need to adhere to the rules of decorum outlined in the posted guidance for addressing the board. Comments must be kept to 2 minutes. Comments that go beyond that time will not be heard. The recorded comment call line is 612-688-3545. The line will remain open 4 hours, and I'm going to call it at 3. It's so close, so it'll be until 7 o'clock tonight. We'll have this, and so again, the number is 612-688-3545. If you want to send an email or a letter to your commissioner, you can do that as well. To speak in person at the board meeting, please attend the annual Truth and Taxation meeting on December 2nd at 6 p.m. And yes, you'd be surprised, there are quite a few people show up. The 2026 proposed budget information and hearing is available at www.hennepin.us/budgets. Thank you, Ms. Wetland. Thank you, staff. The committee's now in recess.
Thank you.